Good morning, sir.
Good morning, Dr. Jyotika.
Yes, sir. We'll start at 9:30.
Okay.
A very warm good morning to respected Yasbir Singh sir and my dear participants. Today, we have the privilege to have Dr. Yasbir Singh sir, Associate Professor of Chemistry and Biomedical Engineering Department of Indian Institute of Technology, Ropar. We welcome you, sir. Prior to joining IIT Ropar, sir was an assistant research professor at the Department of Pharmaceutics, Ernest Mario School of Pharmacy, Rutgers University, USA. The research expertise is few of the areas are polymeric biomaterials for drug delivery and tissue engineering applications. Exclusively working on polymer and peptide-based hydrogen gels micellis for microbites delivery. He has published more than 50 papers in different international and peer-reviewed journals, 4 patents, and 3 book chapters. So, welcome you, sir. Welcome you, and we are honored to have you as a speaker, sir.
So, can I start, Dr. Jyotika?
Yes, sir, you can start, sir.
Can you see my slides?
Yes, sir.
Okay, thank you so much, Dr. Jyotika Devi, for inviting me to this, faculty development program. It is always, so nice to interact with faculty and students, and this opportunity you have given me, so I'm very thankful. I am from IIT Ropar, and of course, I work on drug delivery and antibacterial applications. So what I have thought, because audience come from different backgrounds, so I will give you few slides introduction, basics of drug delivery. Then I will talk about targeted drug delivery. Then I will talk about hydrogels, the system itself, and then I will give you 3-4 examples, of my our work in the lab that we have at IIT Ropar. So this is the way that will go, and then at the end I will take questions from you. So let me start this. Actually, it is the topic of my presentation is polymeric hydrogels for drug delivery. and antibacterial applications. So we first start by asking this question, basically, why we should deliver drug. That is something that we have to understand first. So what are drugs? Drugs are basically, chemicals. And these chemicals are used to, chemical substances that are used to cure, prevent, or sometimes relieve the symptoms of a disease. And that is what you call drug. Drug comes in variety of forms. You can see tablets, you can see capsule. You might notice that they are in ointment, they are in the form of syrup. All that form that you see, drug comes in. And actually these forms are actually called dosage. And this science that actually deals with the development of dosage form is called formulation science, drug formulation science. Now, whenever you look at a drug, so for example, this is very common drug, this is crocin. So when we look at this drug, the drug is not only thing that is present in the formulation. The drug is the active compound, and it is called active pharmaceutical ingredient. It is called active pharmaceutical ingredient, API. And then there are many inert substances that are added to this API to make a formulation, and those are called excipients. What are the problems that a drug faces? See, the two characteristics that are so important in drug business is, remember that you take the drug by mouth. Most of the time you take the drug by mouth. So obviously you take it with water. You don't take it with organic solvent, because organic solvents are harmful to you. So you will take all the drugs by taking water, swallow it with water. So a drug must have some solubility in water. That is first thing. And then when the drug goes into the digestive system, it must penetrate the intestinal membrane to go into the systemic circulation. Systemic circulation means the blood supply that supplies blood to all the body. So it must go into that circulation. And these two are most important property of a drug. Whether the drug is soluble in water, whether the drug is penetrating across intestinal membrane or not. And based on that, actually drugs are classified into four categories. The drugs that come with high solubility, high permeability. They are very good molecules. You can use them as such. But of course, they have other issues that I will come on second slide. So there is a second class of drug that has low solubility, but its permeability across intestinal membrane is high. The third class, class 3, is basically what I am presenting is biopharmaceutical classification system of drugs. Then it has high solubility, but it has low permeability. And then there are drugs which have low solubility as well as low permeability. So if you look at the drug properties, this class 1 are very good, but if your drug molecule falls in class 2, class 3, you have some work to do. And if it is in class 4, you have a lot of work to do, because you have to address this problem of solubility. You have to address this problem of poor permeability. That is basically the challenge in drug. But then there are other issues. I am trying to make a case for drug delivery. I am trying to make you clear what is the difference between drug administration and drug delivery. A very common confusion among the students of drug delivery is that giving drug into the body is drug delivery. No, sir, that is drug administration. How you give drug into the body is just one part of it. How drug is administered. So, making appropriate formulation, you can give the drugs. So, for example, you can take drug by mouth, oral. You can inhale the drug, inhalation, by nose. You can take drug into your eye, ocular. So like that, there are, between teeth and cheek, and then, buccal, then, under the tongue, over the tongue. All these places are used for transdermal patches that are above the skin surface, but they deliver, drug across the skin. Epidural, the drug that is given into the spinal cord, rectum, vagina. Topical means that the drug is applied on the skin surface. Ointments, creams, they come into this category. And do remember that you also take drug by injection, parenteral. And the injection can be given in different ways. You can directly give the injection into the veins that are supplying bloods, that is called intravenous. It can also be given into the muscle, intramuscular, and it can also be given by lifting the skin under the skin, which is called subcutaneous. So this is not drug delivery. Why I am teaching it, giving including it in my presentation, because I want to tell you that drug administration is not drug delivery. They are two different signs. So this is drug administration. But the point that you have to remember, is this, that that see, that when you take drug, so imagine the most common form of drug, it is by taking by mouth. So you take the drug by mouth, and where it goes, into esophagus, the digestive system. I'm not teaching the digestive system. I'm just trying to tell you where it goes. Then it goes into stomach, then it goes into intestine. Now, if you remember your high school biology, what is the job of digestive system? The job of digestive system is to digest things, degrade things. How? By having acidic pH, by having alkaline pH, by having a sort of enzymes. If you eat proteins, that will be converted into amino acids. If you have polysaccharides in your food, that will be converted into monosaccharides, and likewise. So the job of digestive system is not to take drug or supply drug. Its job is to degrade things, digest things. And that's the problem that the drug faces when it goes from mouth to intestine, because it is exposed to acidic pH, highly acidic pH in stomach, then highly alkaline pH in intestine. Then there are proteolytic enzymes and other enzymes that are working on this drug. This drug is exposed to all that, and a part of drug is always lost. So in formulation, you have to take care that your loss of drug is minimal in this digestive system. That is the first problem that actually comes in. But then there is a second problem. What will happen to the drug, when it is in the intestine? Now here, the drug must cross, look at this, the drug must cross the intestinal membrane. And once it crosses the intestinal membrane, it goes into the blood vessel that carries it to the liver. And from liver, see, liver, the job of liver is what again? To metabolize, toxic products. What is metabolism? Metabolism basically converting these molecules, toxic molecules, to some simple molecules that can be eliminated in urine. So your liver also works on the drug, tries to metabolize it, thinking that it is a external harmful object. A part of drug is lost there. And this is called first pass metabolism. And then the remaining drug will go into the blood circulation. So, again, you look, what is the job of blood vessels? In a very layman's language, you ask this question. So the job of blood vessel is to distribute oxygen, distribute nutrients. Where they distribute? To all the cells in the body. Do remember this part, to all the cells in the body. And therefore, the drug that is present in the circulation does not go to the organs, to the part which have disease only. It goes to all parts of the body, irrespective of the fact whether the disease is there or not. That is the second problem. That we have to address, that that the drug is going everywhere. And obviously, some part of body like heart, liver, kidney, they get more supply of blood. So your drug also reaches these organs more than other organs. So these are problems, that drug distribution is such that it goes to all parts of the body, whether there is a disease or not. It doesn't matter. So that is also a problem. And we have to talk about that, how drug delivery can address. So basically, what is happening here is shown here, that if you take drug capsule by mouth, it will go into the digestive system where enzymes and pH will work. Then, once it crosses the intestinal membrane, it will come to liver. Liver will metabolize it. The remaining drug will go into the systemic circulation. Systemic circulation means blood vessels that supply blood to all parts of the body. Sometimes many times you think that if you take drug on the skin or through mouth or through nose or through lungs, then the drug doesn't go into the blood. That is a very wrong concept. Why it is a wrong concept? Because all parts of the body are connected by blood vessels, because those parts are receiving nutrients, oxygen. So obviously all parts are connected with blood. So it doesn't matter where you give drug, all the drug ends up in systemic circulation and then distributed to other parts of the body. So when you give a drug in nose, most of the drug is present in nose, but some part of it is always going to come into the systemic circulation and then again distributed to the rest of the body. That is also an issue, a challenge that you have to address. And then there is also a delivery that is called parenteral delivery. What is parenteral delivery? Basically, you give the drug by injection, mainly into the blood. Why you should do that and when you should do that? See, you realize here, if you look again, if you are taking a capsule, so capsule will be taken by mouth, it will go into your digestive system, then into blood vessel, then into liver, metabolized, then again into the blood. It will take a lot of time. If a patient is suffering from severe pain, how this system will work, where it will take 2-3 hours to reach there. So when a rapid onset of action is needed, you want your drug to act rapidly in hospital situations, injections are preferred. Injections are preferred because you don't take this long, tortuous path. You rather give the drug directly into the blood. It is distributed into the body and you get the activity, you get the effect of the drug. That is one condition when the drug is given by blood. But then there are second condition when the drug is very unstable in the digestive system. Which drugs are unstable in digestive system? You will say, sir, all drugs are unstable in digestive system. That is true. But the drugs like proteins, antibodies, where you are using biomolecules, nucleic acid, peptides, when they are used as a drug, they are especially unstable in digestive system. Why? Because the job of digestive system is to convert this polymer to monomers. So if I take protein drug, by mouth, no protein will be left by the time it reaches intestine. It will be converted into amino acid. So in those conditions, when the drug is highly unstable, you give the drug directly by injection. So this is basically, how you decide whether the drug has to be given by injection or has to be given by other route. Now, let's talk about hello. Yes. So now I am going to tell you that what is basically drug delivery. See, I again repeat that giving drug into the body is not drug delivery. After it has been given, what happens to drug in the body? That means how much goes into the blood, where it is distributed. These parts are actually drug delivery. This is basically drug delivery. So you must distinguish between drug delivery and drug administration. Drug administration is how drug is given into the body. Drug delivery is how much is going into the blood, how much time it is taking, and then from blood, where it is distributing, how this drug is metabolized, how this drug is removed from body. So now let's look at this figure, and this figure that I am showing here is actually the bread and butter of this, drug delivery scientist. And what he is doing here, basically, whether you are giving this drug to animal or you are giving this drug to humans, it doesn't matter. The process is same. Do also remember that it doesn't matter that whether you are taking drug by mouth or by eye or by nose, where the drug will ultimately reach, only in blood. So what is the place where drug concentration should be measured? It is blood. So what happens that if, let's say, that there is a human being and a drug is given to him. So what I will do, I will withdraw samples, blood samples at different time points, and measure the amount of drug that is present in the blood. This is what is done here. And you know what you do in this curve, you basically plot the concentration of drug with time, and you get this type of curve. You get this type of curve. This is drug delivery. Now here, I will also tell you the problem in drug delivery and why a drug delivery is needed. You know, advanced drug delivery is needed. This is very, very important slide that I am teaching you right this time. So you see what will happen that as this drug is coming into the blood, as this drug is coming into the blood, this will increase. This will increase. The concentration will increase. The concentration will increase. And it will increase so much that it may become toxic. It may become harmful. So the drug must be given in appropriate dose so that it doesn't reaches this harmful concentration. But as this is actually absorption of drug. But then as this concentration of drug is increasing, then what happens that drug also starts going into the all parts of the body. This is called distribution. This is called distribution. So it goes to the all parts of the body, the parts where the disease is, the parts where disease is not there. So in target organ where disease is, it will produce effect. And other places it will produce toxic effect, harmful effects. So this is distribution. You see that that the drug amount starts decreasing, it starts decreasing. What else is happening? So there is absorption, there is distribution. But then the enzymes that are present in blood, they are trying to metabolize the drug. That means convert it into a small molecule that can be removed from urine. That is called metabolism and excretion. So there are four parts of the drug, for treatment that are done by the body in the to the drug. So this amount of drug starts decreasing because it is distributing and used by cells. It is being metabolized, it is being excreted by urine, and the amount of drug decreases, and it becomes ineffective, and it becomes so low that it is becoming ineffective. Now, how do you decide that whether a drug has to be taken by, after 3 hours or after 6 hours or after 12 hours? It is decided by this time between two troughs. If this time duration between two minima is 6 hours, you will take this drug every 6 hours. If this time is 12 hours, then you will take your drug twice a day. Whatever doctor does, take this drug twice a day. It is all science. It is not some magic. It is all science. So you see, this is, what is being shown here, and this is drug delivery. This is drug delivery. Absorption, distribution, metabolism, and excretion of drug is what drug delivery scientist does. Not making formulation. Not making formulation. And you also realize, so the first problem with the drug. What is that problem? The problem is this, that it is going to a concentration where it is harmful. Then it is going to a concentration where it is, not effective. It is present in the therapeutic range where it is effective for very short period of time. Do remember, when in your home you have fever, what you do? You take paracetamol. After 30 or 40 minutes, you get, reduction in fever. But then wait after 2-3 hours and you see that fever is coming back. Why it is coming back? Because your drug has reached here. And what you do the right thing. You take another capsule, you take another tablet so that the drug concentration increases again. This is basically drug delivery. But now I am coming to the second problem of drug delivery, that is distribution. And in distribution, I told you that the drug is present in the blood. And because blood is going to all parts of the body, the drug is also going to all parts of the body. All parts of the body. but realize that all parts of the body do not have that problem. So where it is going for no reason, it will produce side effect. It will produce toxic effects. That's a problem. And also think in another way. That there are some organs of the body which get more blood supply because of the function that they do. For example, heart. For example, lung. For example, kidney. For example, liver. So a drug goes more to these organs. It doesn't matter that the disease is not present here because more blood is reaching these organs, so more drug will also go to that organ. So that is a problem. And this example, this problem of poor distribution can be understood by taking example of cancer drug. So there are drugs which are called chemotherapy. Do remember when we use this term chemotherapy, that basically means that the drugs that are used to manage, chemical drugs that are used to manage cancer, that is chemotherapy. Now what is chemotherapy does? It actually kills dividing cells. Why drugs are designed like that? Because in the cancer cells divide in an uncontrolled manner. So the drugs target those cancer cells. They go to those cells and kill them. But there is a problem. The normal cells also divide. Of course, in a controlled manner, but they are also dividing. So your drug will not be able to distinguish between, cancerous cell and normal dividing cells. And it will also go to normal dividing cells and kill them as well. Which cells are actually rapidly dividing in human body? Immune cells, defense cells, you know, hair cells, cells of, stomach epithelium. All these cells are actually rapidly dividing. That's why these patients actually, face this problem of, their nails are gone, their hairs are gone. They always feel vomiting like, because, epithelial cell lining the stomachs are actually gone. And then this person is also open to infection. Open to infection because the immune cells are being killed by the drug. So now you realize that what is the problem in having drug to the wrong places. What is the problem in having these drugs at wrong places? And that is also a challenge. And drug delivery now, I am coming to drug delivery now. Drug delivery actually tries to address these two problems. So now going back again to the same figure, this is traditional drug delivery. This is traditional drug delivery. What is happening in this drug delivery? That the concentration of drug is increasing to a level where it is becoming harmful. That is first problem. And then it is quickly decreasing to a level where it is of no use. It is of no use. It is almost not there. You will need another dose. Now you will say, what is the problem in another dose? There is no problem in another dose if you are suffering from fever. But if you are suffering from a disease that actually requires treatment for 6 months, year, or 2 years, then it becomes a problem. Managing appropriate drug levels becomes a problem. And what actually this drug delivery tries to do, it actually designs systems, drug delivery systems that can deliver drug at predetermined rate. The rate that is determined by scientists, the rate that is determined by doctors. So it delivers the drug at predetermined rate so that the drug level remains in the range where it is effective. And this is basically one of the aim of drug delivery system, to address the problem of fluctuating drug concentration. That is one thing that actually, the system is trying to achieve. And then there is another problem. And another problem is that drug is going to all parts of the body, and mm, it is also going to the parts that are having disease. It is also going to the parts which are not having the disease. So what I can do? So this system, what is called targeted drug delivery, do remember that it tries to distribute more drug to the organs which have disease. Now, what is the common misconception? The common misconception among drug delivery scientists is this, that targeted drug delivery delivers drugs exclusively to the target organ. That is not possible. Why that is not possible? Because you are giving the drug in the blood. You are giving the drug into the body, and this body has a particular system, blood system, circulatory system, lymphatic system, and they are interconnected. So it is not possible to have drugs exclusively to the target organ, exclusively to the target organ at this point of time. But what we try to do things in such a way so that more drug goes to the target organ and less drug goes to the non-target organ. This is targeted drug. This is targeted drug delivery. But when we talk about targeted drug delivery, there are three ways in which we can do this targeting business, and one is basically called active targeting. So how does active targeting starts? Basically, you look at the disease cells. So for example, if I am dealing with cancer cell, I will look at cancer cells. Either I will look myself or I will look at literature. There are scientists who are working on this business. And what they find to do, what they try to do, they try to look at cancer cells and they try to look at normal cells. And their question that they ask is that is there an antigen or a protein receptor that is overexpressed on cancer cell? What is overexpressed? It is present in larger number on the target organ than the non-target organ. So, usually the cells which are diseased, they do have some overexpression of protein receptors, antigens, and things like that. So, for example, cancer cells are known to overexpress many antigens and protein receptors. So, actually, scientists try to identify. Now, what we do as a drug delivery scientist, what we do, we can, now I am presenting polymer, but you can use nanoparticle. You can use any other system that you want to do. But I am dealing with one system right now. So basically what we can do, we can take a polymer. And polymers have different functional group. So using those functional group, I can attach the drug molecule. I can attach the drug molecule. So I have drug polymer conjugate. But then I must also attach a targeting moiety. What are targeting moiety? Targeting moieties are antibodies, proteins, peptides. But which peptide? The peptide or antibody or protein that has the ability to selectively bind to the receptor that is overexpressed on the cancer cells. So when this system is given into the body, it binds in more amount to the target cells. It binds to to the target cells in larger quantity, and it is internalized into those cells by receptor mediated endocytosis, and this is basically called active targeting. This is basically called active targeting. Have a polymer, nanoparticle, or anything you want, attach the drug, and then also attach a targeting moiety that recognizes the antigen or protein receptor overexpressed on disease cells. And then these are internalized into that cell. So more drug goes towards the disease organ, more drug is taken up by disease organs, and this is basically what we call, active targeting. Then there is another targeting. Another targeting, and that is actually called passive targeting. In passive targeting, what we do, we don't attach a targeting moiety. We just change the distribution profile of drug by making it larger. How can you make, these drugs larger? You take the drug. In this case, I am taking a dye, but this can be replaced with drug. The drug was not used for a purpose, but you see that this is fluorescein dye. If you have a chemistry background, this is fluorescein dye, which is attached to polymer. Now, polymer is not necessary. You can attach nanoparticle, you can attach peptide, you can attach antibody, whatever you want, you can attach. So, you can take a drug and attach to the polymer. Drug is usually a small molecule. The molecular weight is less than 1000. But polymer can be, nanoparticle can be very large. So what is going to happen that because of this attachment of polymers to the drug becomes of very large size. And because it becomes of very large size, it is not cleared in urine. It is not eliminated in urine. It rather stays in blood for very longer period of time. And that's why it then distributes to the target organ, more. But the question that you have in your mind, that how and why. So if we take example of cancer, same can be applied to inflammatory cells also, but I am giving an example of cancer cells. So in this figure, you see this inner box is basically cancer. This outer box is basically representing a normal cell. They all get their blood supply. They all get their blood supply. This is your drug attached to a polymer. This is your drug attached to a polymer. So if you look at blood vessels, which are supplying blood to normal cells, you look, this is endothelial cell. These are endothelial cells. What are these cells? These cells actually line the blood vessel. These cells actually line the blood vessel. So if you look at these cells here, you see they are placed very close to each other, very close to each other. And this is technically called that endothelial cells have formed a tight junction. The space in between is not more than 1 to 2 nanometer, not more than 1 to 2 nanometer. So, because of that, these large molecules, which are 10 nanometers, 20 nanometers, 30 nanometers, are not able to go through, into the normal organ, into the normal cells. But when you look at cancer cells are dividing very rapidly. They divide, and divide. But as they are dividing, they also need nutrients. So blood vessels must also divide rapidly. Blood vessels also must divide rapidly. And when blood vessels try to do, these endothelial cells actually develop gap, develop fenestrations. And this is basically called fenestrations. You see, there is a lot of space between two endothelial cells. It is sometimes 100 nanometer, sometimes 200 nanometers, sometimes it could be micron also. So now the same macromolecular drug that did not go into the normal cells can go because of this, gaps that these endothelial cells have formed, because of the large gaps that these endothelial cells have formed. And as cancer cells do not have a drainage system, the drug stays there. And this is called enhanced permeability and retention effect, EPR effect, that was observed by Matsumura and Maeda for the first time, and they reported in cancer research. So basically, by attaching drug to a polymer or liposome or vesicle or micelle or nanoparticles, you can actually deliver the drug to cancer by passive targeting, what is called enhanced permeability and retention effect. This is basically a passive targeting. It is also possible when the disease, that you are trying to target is present outside or accessible from outside. In that situation, you can give the drug directly to that organ, directly to the disease organs, and that is basically called local targeting. That is basically called local targeting. So now I have finished, drug delivery. I have also finished the targeting, active targeting, passive targeting, and local targeting. Now we come to our topic, because our topic is basically polymeric hydrogels. So I want to talk about few slides, 3-4 slides on hydrogels, so that you understand that what we mean by hydrogels. Do remember that my definition, the things that I am explaining here, applies only to polymeric hydrogels. We are not talking about small molecule gels, etc. No, we are not talking about those. We are only talking about polymeric system, because this lecture is dedicated to polymers. So what are hydrogels and gels? Basically, if I take these polymer chains, hydrophilic polymer chains, they are water soluble polymer chains. So these polymer chains are soluble in water. But if I make them interact with each other, so what starts happening that these polymer chains start interacting with each other and form a network which becomes insoluble in water. And this is basically hydrogel and gel, which a hydrogel is shown here. So, what is happening that the polymer was soluble in water, but because I forced it to form interaction with each other, and that's why these polymer chains formed a network which became insoluble in water, and that is basically hydrogel and gel. What is the difference between hydrogel and gel? Very little. If the polymer network is formed by non-covalent interactions. You see here, this is basically one polymer chain. You see, this is your polymer chain, alginate basically polymer. So alginate polymers have carboxylic group. You see, this is carboxylate ion, which is negatively charged. So if I add calcium or some metal ion into this polymer solution, this polymer chain actually starts interacting with this, cation by electrostatic interaction and form this polymer network that becomes insoluble like this. This is a gel. So when non-covalent interactions are used, we say that it is a gel. But you can also do like this, that take the polymer chains and put chemical groups, functional groups, which react with each other. So polymer network is formed by covalent bond. And when covalent bond is used to form hydrogel network, you use the term, hydrogel. So hydrogel is polymer network formed by covalent bond. Gel is polymer network formed by non-covalent interactions. This is Pepper's system of classification that I have described here. Now, you see, basically, this is what I meant by this. You see that polymer chains have formed a network. They have formed a network. And the space between this polymer chain is basically called mesh. Now, why we use this hydrogels or gels in drug delivery? There is a reason. Because this network allows small molecules and large molecules, depending on what is the mesh size, it allows the molecules to diffuse in and out of the hydrogel network. And that means that I can use them for drug delivery business. And there are three possibilities that are possible. One is this, that that the drug size is smaller than the mesh size. Drug size is smaller than the mesh size. If this is the situation, drug comes out by passive diffusion. What is diffusion? A drug going from a region of high solute concentration to a region of low solute concentration. So diffusion, no energy is used. There is a second situation, that the drug size is close to, similar to the mesh size. In this case, there is no one mechanism that actually describes drug delivery. There is a different possibilities that are there, and you have to use this, models to predict the mechanism. There are models that are available that are used to predict. But what is the situation when the drug, for example, we have large molecules like proteins entrapped in a hydrogel. So if the drug is, entrapped in the hydrogel network and it is of large size than the mesh size, if that is the situation, then the drug cannot come out. So what we can do, we have to do some swelling, deformation or degradation of this network so that this drug can be released. So these are three ways in which drug is released from a hydrogel network. How drugs are trapped? Drugs can be trapped into this network by two methods. One is called passive entrapment. Passive entrapment means that you use non-covalent interactions, ionic interactions, hydrogen bonding interactions, hydrophobic interactions. If you use those to trap the drug into the polymer network, then that is called passive entrapment. And then there is also active grafting, where you attach the drug molecule to the polymer chain using a covalent bond. And here, there is something very important that you have to understand, that you can choose a bond. You are not forced to choose a particular bond. Depending on what is the environment in the target organ, you can choose an appropriate bond which is sensitive to pH, which is sensitive to temperature, which is sensitive to engine, to make your drug delivery system temperature sensitive, pH sensitive, or enzyme sensitive. And these hydrogels are actually called stimuli responsive hydrogels or smart hydrogel system. Hydrogels are of three types. One is basically called in situ gelling hydrogels. In situ gelling hydrogels, that basically means that the hydrogel is present as a liquid outside the body. And when it is injected into the body, they start interacting with each other and form a hydrogel or gel. This is called in situ gelling. So you have to mix the two polymer or polymer and cross linker and inject it immediately. Inject it immediately so that it remains liquid while injecting. In body, it will form the network, over a period of time, and that will be gel. These are called in situ gelling gels. And then there are gels or hydrogels which are called macroporous. Macroporous gels have actually interconnected pores, and they can be used for tissue engineering applications. You see that these porous hydrogels can also be compressed by removing water. By removing water, you can actually compress it into a very tiny structure. And then when it goes into the body, it absorbs water and swells back into its original shape. So these are macroporous, hydrogels or gels. Then there is a third category that is called shear thinning hydrogels and gels. These hydrogels have reversible covalent bonds. And because of that, if I apply stress to this hydrogel, it becomes liquid. And once it is liquid, you can do what you want. You can inject it into a system. You can put it into a cast. Whatever you want to do in that time, you can do. And the moment you remove the stress, it reforms the hydrogel. These are called shear thinning hydrogel. And then hydrogels can be given by different routes. It can be given by injection, subcutaneous injection. You lift the skin and place your hydrogel there. If you have made nanogels, etc., you can actually give it into systemic circulation. You can also inhale it. If it is a microgel, you can put it into powder form, and that can be inhaled. But there are also hydrogels which require surgery, so you have to do proper surgery and then place the hydrogel. These hydrogels, when present in the body, over a period of time, they actually release the drug at a predetermined rate. And so they allow rate controlled delivery of drugs, any drug, small drugs, large drugs, whatever you want to use, they allow. And there are other two possibilities in hydrogel. One is this, that you can make your hydrogel non-degradable. Non-degradable hydrogel means that it will stay in your body, and you have to do something to remove it. Sometimes again surgery. But then there are biodegradable hydrogels. Biodegradable hydrogel actually decomposes, degrades into the body, and disappears by itself. You don't have to do anything to remove it. You don't have to do anything to remove it. And this is the last slide before I take 2 minutes break, and then I will start again. This is now my topic which I am going to present. There are many tumors which are local. Of course, tumors are not local also, but then there are tumors which are accessible from outside. Nose, mouth, and on the skin. There are many tumors which are locally accessible. You can access them from outside. And in this tumor, there is an interest. So what is the interest? Basically, the interest is this, that if there is a tumor which is accessible from outside, can we inject a gel directly into that? What I am talking here, locally targeted, gel system or hydrogel system. And once the gel is basically injected into this tumor, it delivers the drug into that tumor. Of course, tumor is connected with blood vessels. Some of the drug will go to the blood and cause toxic side effect, but that will be very small because most of the drug is given into the tumor, into the tumor. So basically, we are talking about locally targeted, locally targeted sustained drug delivery system. And there is immense interest in making these systems. And our work is actually first two work that I am going to talk about now are actually dedicated to this field. So, I will just take, 2 minutes break, and then again teach. I will take a glass of water and then again start. So do remember that I am going to, present, you know, the 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 systems that our lab has developed here. And do remember that we are talking about hydrogels which are injectable. Injectable means that you can inject them through a syringe. They are biodegradable. Biodegradable means that you don't have to remove them. They will degrade by themselves and be removed from the body. That is second thing. The third advantage that our hydrogel system is that they are pH responsive. Why we have made pH responsive hydrogels? Because tumor has a slightly acidic pH. So when we deliver this hydrogel into the body, it doesn't give a lot of drug in the blood, but it gives more drug in the tumor environment. That is the third thing that we have. And our hydrogel systems are also locally targeting the drug. So there is, three, four advantages that these hydrogel systems have. And I'm going now to present. So the first system that we worked on, we used two polymers basically. One was oxidized xanthan and another was, 8-arm peg hydrazide. I will show the structure on the next slide. Here just the cartoon is there. So we took one polymer, oxidized xanthan, other polymer was 8-arm peg hydrazide. And then we mixed the two. But before mixing the two, so what we will do, we will take this in buffer, we will take this in buffer, and the drug doxorubicin will be mixed either with this polymer or with this polymer. And when we mix the two, they actually react with each other. They react with each other and form a hydrogel network that has passively entrapped chemotherapy, doxorubicin. Doxorubicin is used to treat breast cancer, ovarian cancer. So it will release that drug into the body. This was the system that we developed, and this is actually published in Asia's Applied Materials and Interfaces. So this is the work that I'm going to present here. You can look here. This is basically xanthan polymer, and this xanthan polymer has hydroxy groups here and hydroxy group here, vicinal diol. So what we did, we actually treated this xanthan polymer with sodium periodate, and this bond was cleaved, and aldehydes were created. Aldehyde functionals group were created, and this polymer was called, oxidized xanthan. Then we took PEG, and on that PEG, we created this hydrazide group, these hydrazide group. And what we did, we took, we prepared a solution of this polymer and then also prepared a solution of this polymer. And doxorubicin, the chemotherapy, was mixed with this polymer. And then when we mixed all two into one system, they started reacting with each other. They started reacting with each other and formed this network that has passively entrapped drug. and you see the covalent bonds. Please mute your microphone. So you see, it is actually, the two polymers are actually, attached to each other. They are forming network by hydrogen linkage. Now, what is the advantage of using hydrogen linkage? Hydrogen linkage are actually pH sensitive. And why we want pH sensitive linkage? Because tumor has a slightly acidic pH. So in that environment, this hydrogel will degrade faster, and that will fasten the drug release into the tumor environment. So with that thought, this hydrogel system was developed, and then we started doing, if you prepare a hydrogel, the thing that you first do is you try to do rheological characteristic. You try to see what is the storage modulus, what is the loss modulus, is the storage modulus because hydrogels are viscoelastic material. So if they are viscoelastic material, they must actually have higher storage modulus. Please, some students are, some faculty are actually, having their microphone on.
last ஒரு சர்வே கிளிக் பண்ண சொல்லுங்க. அது பண்ணிட்டீங்களா? அப்புறம் வந்துருக்கீங்க. அங்க நீங்க மறுபடியும் போயிட்டு அந்த வீக் 1ல போய் பாருங்க. கிளிக் பண்ணுங்க. அந்த லாஸ்ட் ஆஃப் ஹோம்ல போய் கிளிக் பண்ணுங்க. மேல பாருங்க வீக் 1 வீக் 2
I am doing, sir. I am.
இல்ல லாஸ்ட் வீக் 1 ன்னு இருக்கு அதுல அத போய் பாருங்க.
எங்க இருக்கு? வீக்லி கோலா? Congratulations on completing your course வந்துச்சு.
அவ்வளவுதான். கீழ வியூ சர்டிபிகேட் ன்னு போடுங்க.
ஆனா வரல.
பாத்தியாடி? எனக்கு உள்ளே வந்துச்சு.
Thank you. The first thing that we try to see is this, that you try to measure the storage modulus, and you also see whether the storage modulus is higher than loss modulus or not, because if your system is viscoelastic, the energy must not be dissipated, and that means that the storage modulus must be higher than the loss modulus. That actually indicates that your hydrogel systems are viscoelastic. But more importantly, you also see whether they have self-healing property. Self-healing property means that they deform when stress is applied. They deform when stress is applied, but then they recover when the stress is applied. So we found that our hydrogel system has this. So we did those characterization, and then we started to look at whether our hydrogel system. We started looking at whether our hydrogel system has this self-healing property and can we depict it visually. So what we did, look at this system and you will understand very easily what is self-healing. So what we did, we took a hydrogel. So this is one intact hydrogel, and what we did, we cut it into two pieces. Now we have damaged the hydrogel. In one piece, we actually loaded a dye. And then what we did, we actually put them closer to each other. And you see, they have now joined. And the dye from the stained hydrogel is going into the unstained part. You see the dye is going there. And you see that it is going more. And ultimately, the whole network has almost similar amount of dye. That actually tells that when we place the hydrogel together, which was cut into two pieces, it forms one common hydrogel network, and that is allowing these small molecules to diffuse through. This is basically what is called self-healing characteristic, self-healing properties in a hydrogel. And of course, we then try to pass it through this syringe needle, and we saw that you can indeed pass it through the needle, so it is basically injectable. And we also wrote these letters using this injection system. The more important thing that we wanted to see whether it actually delivers the drug at a sustained system or not. It provides a rate controlled delivery or not, and whether the drug delivery is pH responsive or not. So you see, you can look at very, very carefully this. Basically, sorry, at this point of time, it is not the delivery. We first look at swelling and degradation. So if you look at this, you look at this and this figure, you will notice that at pH 7.4 the swelling is very low. The swelling is very low. And and then actually it slowly starts degrading. It slowly start degrading. So if you look at one hydrogel, for example, one hydrogel, for example, so it showed around 23% of swelling, and then it degraded by 10% in a period of 30 days. So it is slowly degrading. It is slowly degrading. But when you look at pH 5.5, the swelling was very high. We got more than 60% of swelling. What is swelling? Basically, you place the hydrogel in water or tissue fluid and then see whether it is absorbing that tissue fluid or not. If it is absorbing the tissue fluid, there will be weight gain, and that is what is called, a swelling. Then what is degradation? See, if this polymer hydrogel degrades, then what is going to do? It is going to lose weight. So, weight loss is actually indicating that this hydrogel is degrading. And we found that our hydrogel system actually degraded by 36%, by 36%, over a period of 30 days. So what we concluded from this, we concluded that our hydrogels are indeed biodegradable and the process is pH responsive. So then we went on to see whether it is a pH responsive release or not. If you look at the figure, it is very, very obvious. You look at this pH 7.4. Why pH 7.4 is important? Because your blood pH is 7.4. So if you look at this, the amount of drug that is released is fairly less. Up to 40% drug is also only released. Up to 40% drug is only released. This number actually 345 actually tells how much percentage of polymer solution is taken in this hydrogel network. That's all. So if you look at these hydrogels, you see that not more than 40% drug was basically released in a neutral pH. But when you see, when you look at this, acidic pH, why slightly acidic pH is important? Because tumor has a slightly acidic pH. So when we expose it to slightly acidic pH, you see the drug delivery, you see it has increased. It has almost doubled. You see 80% of the drug is being released. And you see the drug release is sustained. The drug release is sustained. And we got this drug release for a period of 30 days. So this result was very good that, this hydrogel has injectable property. This hydrogel has self-healing property. This hydrogel is biodegradable. This hydrogel is also providing a pH responsive drug release, which means that in tumor environment, more drug will be released. In normal environment, in normal physiological environment, less drug will be released. So this is basically what is done. And then you start looking at whether your hydrogels are safe or not. So how do you do? We did by using MTT assay. So, we took fibroblast cells and then we exposed them to the polymers that actually goes into the formation of hydrogel. And you see this actually this number on the y-axis actually represents the percentage of cells that are living, the cells that are living. And you see very high percentage of cells are living. Very high percentage of cells are living even when you when you increase the concentration of polymer. So what we conclude that our polymer that goes into the hydrogel is safe to fibroblast cells. And then of course we did live dead assay. In live dead assay we use two dyes. One is green dye, another is red dye. Green dye indicates, if the cell takes green dye, that indicates that it is living, and if the cell takes red dye, then that indicates that it is dead. It is dead. But if you look at this, if you look at the cells which were treated with hydrogel extract, you see that the signals that are coming is predominantly green, not red. That actually indicates that actually the cells are living. So encapsulation in hydrogel doesn't kill those cells. So this hydrogel is fit for cell encapsulation also. But last study that we did, we started looking at, does it kill cancer cells? Does it kill cancer cells? And what we did, we actually took the hydrogel and let it release the drug. and the drug that was released was then, given to these, cancer cells, lung cancer cells, A549. And what we found that actually cells started dying. The cells started dying. If you see, initially a lot of cells were dead, and then actually it reduced a little. It reduced a little, but nevertheless, the cells were, getting, killed. Cancer cells were getting killed, when they were treated with the drug that was released from the hydrogel. And if you look here also, if you take cancer cells and treat them with the hydrogel extract that doesn't have any drug, these there are mostly living cells. But when you treat these cells with dogs, the chemotherapy, you see that the cells have started dying, which is evident from this red emission. But same thing happens when you treat those cells with dox loaded hydrogel. There also you see that red color has started appearing, that indicates dead cells. So basically, from this we conclude, we conclude that actually, we conclude that basically, that these hydrogels are killing the cancer cells. Okay, so this is one hydrogel system. So you see, so what we started thinking, what we started thinking that, okay, we made this hydrogel system and there is a sustained release for, 4 weeks time. But we thought that can we extend it further, because we were interested in making a hydrogel which is long term. So we thought, can we extend it? So, the thought process was that how do you do that? So in that thought process, what we thought that when we made this hydrogel, we actually passively entrap the drug. So what if we attach this drug covalently to the polymer matrix, to the hydrogel matrix? If that can be done, probably the drug release will become more slower. And with that thought, we actually made another hydrogel. And that was PEG hydrogel. This actually work was published, in biomicromolecules. So what is this work? You see, this is PEG polymer. This PEG polymer has aldehyde group. Look at this PEG polymer. This PEG polymer has hydrazine group. So what we did, we actually, took this dox, this doxorubicin, and reacted it with this polymer. So, they reacted with this polymer and formed, PEG-DOX conjugate by hydrogen linkages. But what we did here, is partly that we did not use a lot of drug. We use the amount of drug in a controlled manner so that only a part of this polymer is taken up by the drug. The rest remains free for hydrogel formation. So we took this PEG-DOX conjugate and mixed with the other PEG polymer and let them form the cross-link. You see, it formed a hydrogel network. But in this case, there is a difference. What is the difference? The drug is not trapped passively. It is rather covalently attached by hydrogen linkages. Now, what is the advantage of using hydrogen linkages? Actually, presence of covalent bond will further slow down the drug release. That was the idea that we worked on. And then we started looking at whether it works in a way that we thought or not. Here, you can see, again, we have used two hydrogel system. One is 5% and another is 10%. And, you try to look at the drug release that was done at pH 7.4. You see very less drug is released. not even 40%. If you see, it is around 30% drug that is released. But you see, what the point to be noted is this, that this time we got the drug release up to 45 days. So basically we reach 1.5 months. But the moment this hydrogel is exposed, to a slightly acidic pH, you see the drug release increases, and we are actually achieving 80% drug release. And the drug release is sustained for, again, 45 days. So the results were really, really, very, very interesting. And you see, you can look at what we did. We took the picture of hydrogels after the drug release. So you see, if you look at this hydrogels that were exposed to pH 7.4, physiological pH of blood, you see, you can see visually also that much of the drug is still left. But when you look at these hydrogels which were exposed to pH, slightly acidic pH, just like tumor microenvironment, you see they have become almost colorless. So that actually indicates that the most of the drug is actually released. So this was the advantage that we got here. We actually could sustain the release for 45 days by covalently attaching the drug to the polymer or hydrogel matrix. So that's something that is very, very interesting here. And then this time we decided that we will not do cell culture, because see, cell culture is the two-dimensional thing and tumor is three-dimensional. So what we did, we actually created this spheroid structure where there is a clump of tumor cells, and you see these spheroids were formed, and they were treated with peg dogs, they were treated with dogs, they were also treated with peg dogs that is released from hydrogel. And you see, in all the three cases, you see there is a tumor shrinkage. The tumor is shrinking, and that actually tells that our system is effective. So maximum shrinkage we got in dogs, and then peg dogs, and then when we use the hydrogel release media. Now the result looks like that it is not a good result, but the result is good, because you see we are using doxorubicin that is trapped in hydrogel, and we are releasing a small amount of drug. So the cells will be eventually killed. At any given point of time, it will be less than doxorubicin. That is normal, that is expected, because there the drug is free, it is going to kill all the cancer cells faster, but then it will also produce toxic effect. But here the less drug is doing the same thing, and it will keep doing. See, doxorubicin will have to be given every now and then, but this system will be working for 45 days. So those are the benefits that are there. So this was the second hydrogel system that we developed, and then we went on to work on a slightly different setup, and we actually got interested in wound healing. So we started looking at that we have a pH responsive system. Why not try for wound dressing? So if you want your hydrogel, and hydrogels are applied on wound dressing. So if you take hydrogels, for example, for wound dressing, so we thought that what are the characteristics that are required. See, if you are using hydrogel for wound dressing, it must absorb the tissue, exudate, blood, water, whatever fluid is coming out of the wound. So it must absorb that. It must also provide a clean and moist environment. But more importantly, it must prevent infection. What is the greatest challenge in wound? The infection. So that infection must be prevented, and then it must also allow tissue regeneration. So how we can achieve this, preventing infection and allow tissue growth? We can do it by releasing antibiotic and protein growth factor. So with that thought process, we actually developed, here you can see, we took a PEG, which has two glyoxylic aldehyde functional groups. And then we took chitosan polymer, which has these amine groups. So when we mix the two polymers, they started reacting with each other. They started reacting with each other to form a hydrogel network by imine linkage, biodegradable imine linkage. So, and the drugs, antibiotics and proteins were actually mixed with either of these polymers. So that the antibiotic and proteins were actually passively entrapped. And then, we started looking at whether it is releasing or not. So in fact, we made, different system, 3%. Means polymer, percentage in that, hydrogel was 3%, 6%, 9%, and 12%. We found that as we increase the polymer concentration, there is more sustained release. So, this basically, if you look at 12% hydrogel, what we found that it is releasing up to 80% of the drug, and the drug release is sustained for up to 24 hours. It was able to sustain the release for up to 24 hours. And if you look at proteins, the protein release was also, around 90%, if you look at the 12%, around 90%. But the protein release, because protein is a large molecule, it was sustained not for 24 hours, rather 120 hours, around, a week time. Actually, it sustained the release of protein growth factor. So that was actually, interesting thing that we observed. And then we started looking at whether this hydrogel is safe, to the cells or not. So we took fibroblast cells, NIH-333, and what we found that the cells are viable. So this is basically controlled when cells were not given any treatment, and when the extract of hydrogel was given to those cells. You see that there is a very slight difference between them. Most of the time, the cell viability remain higher than 80%, which is basically good. So, and then as the same thing we observed when we did, encapsulation of cell, we found that the cells are living. So basically, we can say that the hydrogel delivers, antibiotics, which is sustained for a week. It also delivers, protein, which is sustained for a week, and then it is safe to, mammalian cells. It is also safe to mammalian cells. And then we started looking at, this, whether it is antibacterial. So what we did basically, we actually did this zone of inhibition studies. So you can see that, as you start, treating them, see, this is Escherichia coli, and this is Escherichia coli basically. And if you look, this is your blank. And if you look here, we have taken 3%, here we have taken 6%, here we have taken 9%, and here we have taken, and this basically represents that actually, that antibiotic is diffusing into this, gel, and then it is killing the bacteria that is present here. So, we found that, and then we also, at the same thing, actually, this, percentage inhibition is also shown here, 3%, 6%, 9%, and 12% in first 6 hours. How much inhibition, actually bacterial inhibition, was caused is actually shown here. So 12% hydrogels actually cause maximum inhibition in 12 hours, which is expected because they are releasing more antibiotics and they are sustaining the antibiotic release for a long period of time. And we also did live and dead assay. So when the bacteria were treated with the hydrogel extract, you see the emission that is coming out is largely red, not green. So that actually indicates that the bacterial cells are dead. So this is actually another third piece of work that I wanted to present. And then I will just talk about last thing. I will be done in 5-10 minutes. So this is basically last example that I am taking. So I gave you 3 examples of, as this, FDP is focused on polymer targeted drug delivery. So I took 3 examples on drug delivery. The last one was wound healing, but still it was a drug delivery example because we are releasing antibiotic, we are releasing a protein growth factor. But now I am going to give you only one example. The other thing was published in Asia's Applied Biomaterials. Now I am going to talk about the implant-associated bacterial infection and then our work on peptide gels. So, few slides more and then I will be done. And then I will leave 20-30 minutes for discussion. So basically, medical devices that go into the body are prone to infection, are prone to bacterial infection. And anything, bone plate, artificial, hip, knee, whatever you put into the body, the medical devices, the artificially made, engineered devices, when they go into the body, they are prone to infection. Now, infection can happen from any bacteria, but the major problem is basically SODS. This bacteria is most notorious, and this actually results in high death rate. This results in high death rate. And this is basically what is called implant-associated infection. This is basically what is called implant-associated infection. And this is a major challenge, in this, this medical device business, because these medical devices that are being, placed in body, they are actually, infected by bacteria. Now, what is happening here, that this bacteria actually, these medical devices that actually we are using, they have a surface. And what happens that surface actually attracts the bacterial cell, planktonic bacterial cells. Planktonic means free cells. So these cells actually interact with the surface and then adhere. Once they adhere, they start interacting with each other and also with the surface. And that leads to clustering of this bacteria. That leads to clustering of this bacteria and forming of, microcolonies. And then actually it starts actually, multiplying. It also starts, releasing virulence factors, and then actually that actually leads to, and then extracellular polymeric substances, and that actually leads to the biofilm formation. This biofilm formation is very harsh, because once there is a biofilm, it is really difficult to treat, because this bacteria becomes inactive and it is protected by this film structure. So it is difficult to treat. So this also happens that these bacteria form biofilm on the medical device surface or implant surface, and those are very difficult to treat. Not only that, there is also a problem that now increasingly, our doctors are reporting for last decade, they have been reporting that there are bacterial strains which are not responding to antibiotics, and this is called antimicrobial resistance. This is called antimicrobial resistance. Not only that, bacteria is not responding to an antibiotic. Scientists have and clinicians have also started reporting that basically there are bacterial strains which are resistant to more than one antibiotics. Now that is challenging. That is challenging, because then this thing that we have overcome, that we think that we have actually control with, is not there. And already in world there are already 700,000 deaths every year because of this type of infection. And World Health Organization has actually done some estimation, and they say that if we don't do anything by 2050, it will start killing 10 million people. 1 million has 10 lakh. So basically 10 million people we are talking about by 2050, and this map actually shows the burden. This blue color means high burden, and then as the color becomes light, less burden. So if you look at our own country, India, it is present in this this dark blue region. That means we will have a high burden of this disease, and that's why World Health Organization has called for developing new antibacterial materials. Not only new antibacterial materials, they also want antibacterial materials which are not likely to cause this antimicrobial resistance. So, scientists are working on this issue for quite some time, and they are exploring silver ions, silver nanoparticles, gold nanoparticles, carbon nanotubes, graphene oxides, and nanopattern surfaces. All are being investigated to treat this bacterial infection. But there is also, of course, they are showing some promise. They have some challenges. So scientists are working on it. But basically, in the same count, there is also, self-assembled peptide gels. So, you take peptides, there are peptides naturally present, which are heavily antimicrobial, highly antimicrobial. And if you take these, self-assemble these peptides and try to self-assemble them into gel, these gels are found to be antibacterial. How? They actually, interact with the cell wall and membrane component of bacteria and compromises the integrity of membrane. And as a result, the contents of the cells are leaked outside and the cells die. Unlike antibiotic, they do not target the cellular pathway. They do not target enzyme. They do not target, biomolecules that are present in the cell, which are involved in a particular pathway. So scientists believe that bacteria is not likely to develop resistance against this because the effect is more like a rupture of cells, mechanical type, That is basically what is there. So this is what is shown here, that this bacteria is actually interacting with the bacteria, and then it is compromising the integrity of membrane, and the contents of cell are leaking, the bacterial cells are dying. Now, antimicrobial peptides, are interesting, and they are really showing interesting properties, but it has been found that they are kind of, unstable. So if they are applied in human body, there are proteolytic enzymes, medical devices will be applied there. So there are proteolytic enzymes that actually cleave those peptides. How to work on that? So, there is, a lot of work going on in peptide business where scientists are trying to make it proteolytically stable and highly potent. Two characteristics they are working on. And so what we thought, we knew that, that FF, two diphenylalanines actually are antibacterial in nature. But their antibacterial activity is not enough. So what we thought that, to make them stable, see, the enzymes, proteolytic enzymes that actually, recognize these peptides have a preference for L-amino acid. So we thought that what we can do, we can take two phenylalanine amino acids in D form so that it is not recognized by the proteolytic enzyme, and mm, it will be stable in D form. And then we thought that we will add a third amino acid which is cationic in nature. Why cationic amino acid? Because cationic amino acids are known to be antibacterial. So we prepare two tripeptides in one, this one end of FMAR, this is FMAR protected peptides. So what we did, we took two phenylalanine and added a histidine. We took, two phenylalanine and added arginine. So two tripeptides were prepared, and then we took, aqueous DMSO, and we found that at appropriate concentration, these peptides actually self-assemble into gel. Self-assemble means by non-covalent interactions. And then we did, this is basically FF, this is basically HFF, and this is RFFF. So we actually did same studies, and we found that the first two are showing this nanofiber, structure, this and this are showing nanofiber structure, but this is showing a wavy type, network.
Sir,
Dr. Jyotika, can you tell me which slide I was on?
Sir, slide is not showing right now.
I will show.
Yes, sir.
So when I was,
Sir, slide is not visible.
yes, I know.
Sir. Yes, sir. Next. Welcome back, sir.
Hi. So, Dr. Jutika, what do? I take questions or try to finish it?
Sir, introduction session is there, sir. Yes, sir.
So, I take questions directly, leave the remaining talk.
Sir, after you finish, then participants will interact with you, sir.
Okay, so I will take 5
Continue, sir.
minutes. Okay, I will just take 5 minutes. I am very sorry, actually, my system crashed completely. So, I have to restart everything.
No, sir, it's okay, sir. Because it is a very informative session.
Which slide I was? Can you just tell me?
Yes, sir.
Okay, so we basically made, peptide gels by putting, two phenylalanine and one cationic, histidine and arginine. So then we started or not. So if you look on this figure, this is your diphenylamine. This is the one with histidine. This is the one with arginine. And when we expose them to, proteolytic solution, what we found that really they have very good stability. You see in 24 hours also, or if you look at 48 hours or 78 hours, not a lot of peptide is degraded, so less than 30% degradation was there in 72 hours, and that was very good result. We were very happy with that because it was best in class. So then we started looking at antibacterial activity. And what we said that let's take two strains. One is Escherichia coli, which is gram negative, and one is S. aureus, which is gram positive. And S. aureus is the one that is actually causing this, medical device. It is prime thing. So what we did, we started looking at the antibacterial activity, and you see, sorry, the antibacterial activity. If you look here, you see almost close to 100%, somewhere 98, somewhere 99. If you look at this, results for E. coli, you look at the results at S. aureus, you see, of course, you will see that two are not killing. These two are this one, FFF and HFF. The third peptide, RFFF, is very active against bacteria, and it is killing almost close to 100%, bacteria, and both bacteria. We try to do, by doing, colony forming units. So, we were told that it is better to count colony forming unit rather than, doing this non-viable bacteria. So we did colony forming unit also, and there also we found that it is indeed killing bacteria very efficiently, very efficiently. So with this result, then we started looking at, mechanism, that what is the mechanism that is responsible for this action. And you see what we did, we took bacteria, we incubated it with the peptide gel that we have prepared, RFF, and then we look it under high resolution 10 images. And here you can see, this is E. coli. This is, control E. coli. It is not treated with anything. You see, the contents of cell are present within the cell. But the moment you still look here, you start looking at, you notice that the contents of the cells are leaking out. Contents of the cells are leaking out. So basically, what is happening here is this, that our gel integrated with the bacterial membrane component and caused cell lysis. The contents of the bacterial cells were leaked, and that is leading to cell death. Basically, there is a cell rupture. And in the other case, S. aureus, we found that these these bacterial cells actually started shrinking. And this shrinkage actually indicates that basically there is, damaged cell membrane, and there is this, the bacteria is dying by necrosis and apoptosis. So we actually using this HRTM technique, we conclusively proved that our gels are indeed interacting with these bacteria and then causing cell death. But then you have to, because HRTM is telling that there is a leakage of contents and all that, but it is not an evidence of dead bacteria. So we did, again, live dead assay, and you see E. coli S or S, when they are untreated, they are giving that green fluorescence. Why they are giving green fluorescence? Because they have taken up the green dye, which goes across living, intact membrane. But when we treated them with, with this basically, hydrogen, sorry, peptide gel, what we found that they are showing red color. That means this red dye goes across damaged membrane. And that actually indicates that this E. coli are indeed dead. These, very severe death actually it caused. You see, they are forming plaques also here. So we found that results are very, very promising. So our our gels are not bacteriostatic, rather they are bactericidal. They are killing the bacteria. And this is actually by interacting with the membrane. And then we did, we took the gel extract and we, treated them with these cells, mammalian cells, and we found that our systems are safe to mammalian cells. So there is no worry that it will cause any toxic effect to human cells, mammalian cells. So that was actually published in ACS Biomaterial Science and Engineering. So with this, basically, let me conclude my talk. What I said that, when we talk about traditional drug delivery, now you must be able to distinguish drug delivery and drug administration. So when we look at traditional drug delivery, there are two problems. One is that concentration fluctuates. Sometimes it becomes very high, sometimes it becomes very low. And the second problem is this, that it distributes the drug to all parts of the body. It doesn't matter whether the part has disease or not. That is basically, causing toxic side effects. So what we can do, and that's where actually this drug delivery systems come. So we can design drug delivery systems which actually provide rate controlled or sustained drug delivery at a predetermined rate. That is basically so that drug concentration doesn't fluctuate. It remains in the range where it is effective. Or we can also, apply targeting approaches, active, passive, local, so that more drug goes towards the organs that have disease. I presented 3 examples of biodegradable, self-healing, and injectable xanthan PEG, and PEG chitosan hydrogels. And I showed that they actually provide pH responsive sustained delivery of chemotherapy, antibiotic, and protein. And then I talked about, and I'm sorry that in that time actually my computer crashed. So we also prepared self-assembled gels from antimicrobial peptide. And we showed, we prepared a system that is very stable, most stable than anyone who has reported in literature. So, it is most stable and highly bactericidal. It kills bacteria. And as this gel actually interacts with the membrane, it doesn't, target the molecular cellular pathway. This gel is not likely to cause, resistance against it. But more importantly, you do research, you do things, but more important, my aim with today's interaction is this, that you get interested in drug delivery. If you know polymer, if you know polymer modification, you can make hydrogels, you can make gels, you can get drugs, and you can start some work. The field is very interesting, and you can also go beyond this drug delivery, go to tissue engineering, go to enzyme mimetics and other fields that are also related and relevant. Wound healing. So this is basically the whole idea of interacting with you today. And then I want to say thank you to the organizer and thank you to all the participants who actually attended my interaction. Basically, these are a list of my students, and these three students have already graduated and they are doing jobs at different places. The work that I presented here was not all but some part of their work. So Dr. Kamal Malhotra, Dr. Piyush Sharma, and Dr. Neelam Chauhan. So their work actually I presented. I do have, active collaboration from many scientists. So I have listed some: Rajkishore Rai from CSIR, IIM Jammu, Rajesh Nair and Durga Pal from IIT Ropar. And then I also received funding from CSIR, SERB, DBT, and recently India, Taiwan. So basically, basically funds are very important in this research enterprise. And without fund, you cannot do much. So that actually everything starts from there. So I'm very, very thankful to you. And now I thank you all for attending this lecture. I will be happy to answer your questions. Thank you again.
Thank you, sir. Thank you very much for this such an informative session, sharing all the details of drug delivery techniques, therapeutic window, polymeric hydrogels and gels for drug delivery and antibacterial applications, focusing on chemotherapy, self-healing properties, efficient wound healing using polymeric materials, implant-associated bacterial infection, and traditional drug delivery. We thank you very much, sir. And the session is now open for interaction. If any participant says anything to ask, sir, please raise your hand. We will unmute you.
Someone is asking to unmute. Yes, please ask.
Yes, sir. Thank you so much for your wonderful presentation, sir. Nice one. This is Dr. Dharmalingam from CBIT Hyderabad. Sir, actually, I want to know about because you are experienced professor and you are working various areas of this peptide-based hydrogels and other things. Sir, this peptide-based hydrogels are killing the micro. You have clearly shown the mechanism also how when the ruptures or shrinks E. coli and Staphylococcus aureus through HR term. If it is killing the peptide hydrogels are killing the bacterial cells, means why it is not killing the L929 cell lines? Okay, if it is not killing, then what kind of mechanism our cells these cell lines adopt? So what kind of mechanisms do you know, sir?
Yes, very good. Basically, what is happening that that this bacterial cell and this mammalian cells, their lipid composition is slightly different from each other. So that actually allows these cationic peptides to interact with the bacterial membrane, but not so much with the mammalian cells. And that's why, in general, unless you have added something on the peptide from outside, it is less likely to cause toxicity to mammalian cells. It is less likely because of the different lipid composition.
Okay, sir. So you are telling because of the cell composition of the human cells and bacterial cells, that is a difference. So our cell adopts this.
Our cells survive and not the other cells.
Ubiquitin pathways are involved, sir, in this kind of, sir, that I don't know, sir. This I heard that this any ubiquitin pathway they are telling, sir. I don't know. I'm not clear. Some pathways are because when I also this I'm also working this peptide. I'm not working in the peptide based. I'm polymer based hydrogels. I'm working CMC based. So when same things I found, it was the reviewer asked. And I said I have referred some papers. They said some pathways are there, but I couldn't understand that pathway. That's why I'm asking
Okay,
if you
what
can tell
happens?
exactly the
Okay,
pathways.
what happens that when you use antibiotic, for example, so antibiotic has to work in some way. So
Yes, sir.
let's say that there is, let's say we can take an example. So there is an
Yes,
enzyme which is called transpeptidase. What does that
yes,
enzyme
sir.
do? It actually forms cross-link into the peptide cell wall, and
Yes, sir.
that makes
Yes, sir.
bacteria stable. So what
Yes.
penicillin does, it goes and binds to that transpeptidase enzyme. That is cellular
Yes, sir.
pathway. That is cellular pathway.
Yes, sir.
It is targeting an enzyme. And living system has possibility that they can evolve another enzyme. All living system has this ability. So, for example,
Yes, sir.
the bacteria that used to be targeted by penicillin have developed another enzyme which is called penicillinase. And what happens that when
Yes,
you
sir.
give penicillin to these bacterial cells, that goes to
Yes.
penicillinase, not the original target. That is what we meant. That
Yes.
that living systems have capability to evolve. So when you target their enzymes, when you target their proteins, when you target their pathways that are involved in some metabolic form, so then they can evolve over it. But they cannot evolve over, they cannot make a membrane that is so strong that it can survive nano pattern surfaces or nanoparticles, etc. Because bacteria has to have certain strength. It cannot go beyond that. No? It is a unicellular cell. So that is the thing.
Yes. Yes, sir.
The effect is mechanical here. And that's why
Yes, sir.
nanoparticles and nanoparticulate surfaces and these gels are considered to be more promising.
Yes, sir. Yes, sir. That's good, sir. Yes, nice, sir. I got it, sir. Sir, another question, sir. Sir, whenever we go for this kind of peptide-based hydrogel, sir, because the preparation is very difficult and also even difficult also how much we can because optimize. But for larger quantity purpose, the cost-wise, larger quantity, how we can go for, sir, in future?
Yes,
So
yes, you are
in
right
future.
that see, peptides can be synthesized these days.
Yes. Okay.
Automatic synthesis is manual. But your question is, of course, right that making these gels, self-assembled gels at a large scale will be a difficult enterprise.
Okay, sir.
That is correct, and that is also a part of research that for example, when this liposome drug delivery system were developed, there was no
Yes, sir.
system in our whole world because liposomes require refrigeration, and so these type of, and they are not stable for very long period of time, and then you have to
Yes.
formulate them in a certain way. So there
Yes.
was a difficulty, but as people realize, so they started having a system for that also. So what I am trying to tell you here is that that is also a part of research, that how to make it system that is easy. That means that, for example, I have to prepare a system where peptide is present in a freeze-dried form. And what
Yes.
instruction says that add this and form a gel. Obviously, many peptide gels actually use little organic solvent. That also is not acceptable. You have to go to a complete water-based system. So that system. But right now, these peptide gels, we are talking about medical devices. So basically, what we are imagining that we have a coating on the medical device of
Okay,
nanoparticles.
sir. Okay.
That is doable. That is doable.
Oh, okay, sir. Okay. Yes, sir. That's true, sir. That's true, sir. Thank you, sir. Thank you so much for your clear explanation, sir. Thank you, sir.
You're welcome.
Dr. Anupama Rajput had has raised her hands. Please, you can ask.
Yes, Dr. Anu, please ask.
Yes, good morning, sir. Your session was very informative. My question is that, is there any preventive measures to avoid the bacterial infection during the implant?
Yes, definitely. These days, in medical devices, first thing is this, that first thing I will start first. First thing is this, that you try to look at the surface also. Not only composition, also, it is smooth or rough. It has patterns or not. So that is one thing that is being looked into, that how we design a surface that it less interacts with bacteria. That is one thing. But then the second thing is this, stethoscope and other medical devices. They are also thinking that can we have, and in some cases they do have. What they are putting is this, that they are putting a coating of nanomaterial like silver, for example, which is known to prevent bacterial adhesion, etc. So those type of things can be thought where, see, the P will be not allowing the bacteria to adhere. That is the preventive step. That is the
Okay.
preventive step. If you don't allow to adhere, then the battle is half won.
Okay. Okay, sir. Thank you, sir.
Sir, I have one thing to know. Sir, polyethylene is used, and can some polyvinyl alcohol also be used?
Again, can you repeat polyvinyl alcohol?
Sir,
Polyvinyl systems.
polyvinyl alcohol, sir.
Yes, polyvinyl systems are used. I have not read about antibacterial system, but I know that they are used in drug delivery. They are used. Polyvinyl alcohol based systems are used, but I will check about antibacterial. I have not seen it, but I will check it.
Yes, sir. Thank you very much, sir. We are privileged to have you in this session, and we thank you for spending 2 hours your valuable times with us and sharing your this such an informative recent applications of polymer. Thank you, sir. Thank
Thank
you
you
so
so
much.
much, Dr. Jutika, and thank you for inviting me to this session. It is always a pleasure to
Yes,
interact
sir.
with faculty.
And sir,
Thanks.
on behalf of CIPET CSTS Guwahati, thank you, sir.
Can I leave?
Yes, sir.
Thank you.
Dear participants, now tea break is there. At 11:45, we will meet again. At 11:45, we have Professor Pralay Maiti from IIT BHU. He will speak on the topic polymer nanocomposites and their biomedical applications. So you can be on the same line or you can rejoin in the same link again. So please be there at 11:45. Thank you. Good morning, sir. Sir, am I audible to you, sir? Am I audible to you, sir?
কি নাম ছাৰৰ? ছাৰৰ মাইকৰ প্ৰব্লেম আছে।
We request all the participants to kindly stay online due to some technical problems from professors. We are just waiting for 2-3 minutes.
Can you please hear me?
Yes, sir. You are audible, sir.
Oh, okay, okay. So now what I will be doing, I will be check my once I will upload. I mean, I took the another computer. He will go. I हमारा computer यहाँ पे सेव नहीं है ना? नहीं 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 वो नहीं नहीं यहाँ पे है हमारा मेल पे है. मेल कहाँ पे होगा? मेल पे है. यही हमारा मेल है. यही ना? यही ना? ठीक है. ये यहाँ पे ओपन करके सेव कर लेंगे. इसको शेयर कर देंगे. उसको खोलेंगे तो वहाँ से हाँ सेव कर लेंगे. यहाँ पे इनका डेस्कटॉप में सेव कर ले रहा है. 1 minute please. Please give me some time to upload the file of my talk.
Sure, sir.
Yes.
Sir, in the meantime, just in front of our all distinguished participants, I want to present your, introduce your before him.
Please.
Very good morning to all the participants.
Enable content.
Respected Professor Praloy Maiti sir from IIT BHU. Today we are very much fortunate to have Professor Maiti for his lecture on polymer nanocomposites and their biomedical applications. I'm extremely happy taking this opportunity to introduce him before you. Professor Maiti sir is in the School of Material Science and Technology, and I am very much happy to inform you that he has 21 numbers of patents and more than 500 peer review research publication in international journals. Professor Maiti sir's research area includes like polymer nanocomposites, biomaterials and implants, cells assembly, biodegradable polymers, polymers from renewable resources, radiation resistance polymers, fuel cell membrane, safe memory polymers, polymer as energy materials, etc. Professor Maiti, he was in COE researcher and lecturers at Pensure Business Laboratory, Hiroshima University, Japan, and he did his postdoctoral fellow at Toyota Technological Institute, Japan. He was visiting scientist at Cornell University, USA, and he was a quick hair fellow at Central Leather Research Institute, Chennai, before he joined in this School of Material Science and Technology in IIT. And the list of awards and honors are very long for Professor Maiti. So just I want to mention a few from this list of awards. Professor M. Santa Pa Silver Jubilee Award given by Society of Polymer Science he received in 2010. He was also recipient of APA Young Scientist Award by Asian Polymer Associations. From Ministry of Chemical and Fertilizer, Government of India has offered him National Award for Technology Innovation in 2013. In 2013 again, IUS in New Delhi has given the honor for special recognition of important contribution of research using IUSC facilities. From National Academy of Sciences in 2018, he got NASI Reliance Industries Platinum Jubilee Award. And again in 2020, from the Department of Biotechnology, Government of India, he got the Tata Innovation Fellowships and many more. So with this a short introduction, I again would like to welcome Professor Mighty sir for his talk on this polymer nanocomposites and their biomedical applications in various fields. Uh, uh, now over to Professor Mighty sir.
Okay. Am I audible? And
Yes,
can you
yes,
please,
sir. You are audible, sir.
Can you see my first slide?
Yes, sir. It is visible, sir.
Okay. Thank you. Sorry for the inconvenience caused. And at the outset, I'd like to thank the organizers for giving me the chance to talk about some basics of polymer nanocomposites, and which I am working since the last 30 years or so. And and special things that the CIPET organizers like that the how the composites are polymer nanocomposites are being used in the drug deliveries and or in general the biomedical uses. So I'll be talking mostly on the drug delivery, and as we design some of the polymer composites for the vehicles for drug to have regulated deliveries at the different locations of our body depending on the need and so on. So let me just start with some fundamentals of the polymer composites. And okay, so this will be the outline of this talk. First, I'd like to talk about the definition of composites or nanocomposites, and then various preparation technique, and then structure property correlationship of polymer nanocomposites and their applications in terms of its biomedical use of the polymer and nanocomposites. So that's what I put it in part 1 and part 2 maybe, and 1 hour each. Okay, so sorry, I mean, just I do check one. I am changing my slides, and is the slides are visible clearly?
Yes, sir. From here it is visible, sir.
Okay. Thank you. So just to start with the definition of a composites. So it's basically a mixture of 2 or more components, but any mixture is not called as this composite. There is some regulations through which we can call any mixture as composites, and the definition is 1 plus 1 is equal to 2 plus alpha. So this alpha is the synergistic effect when the two components are added together, and because of this mixing, and there is some synergistic effect. This is something like I mean, the two students individually cannot solve a problem, but if they combine and join hands together, they can solve the complete problem. So this is what is called as the synergism, and this is how we mathematically defined as this alpha. So this is the definitions of these composites, and then it is not related to or restricted to 2 component only. Maybe more than 2 components is fine in this composite. Maybe the components can be of various types, fundamentals, materials like polymer, ceramics, metals, and so on. So any two component of them are mixed up, and then we can get the composite out of it. And then the composite have the maybe the two component. One is the matrix. The definition of matrix is which is holding the other component, and another component is the filler, which improves the property of the matrix. That is definition of the filler. Now the filler can be of any size. Say if we have a concrete for this house, and the roof is made of the concrete, where the size of the filler, which is basically the rod, the size of the dimensions of the building is as long as several meters or tens of meters. And we can go or come down from meters to micrometer to nanometer level. And then if at least one of the dimensions, I mean any material has three dimensions, x, y, and z, at least one dimension should be of the order of a nanometer, and then we call them as the nanofiller. That's the definitions of the nanofiller. And if we put nanofiller into a polymer matrix, we call them as the polymer nanocomposites. This is the basic definitions of this polymer nanocomposites. And I will be telling you that how, if we bring the size down to the nanometer dimensions, what are the extra effect of it. That's the almost the idea, or the basics of this the talk. And the nanofillers, we can confine the dimensions either in one dimensions or two dimensions or three dimensions. If we confined all three dimensions x, y, z of a material, then we call as the zero dimensions. And here it is the zero dimensions, like the quantum dots of size maybe less than 10 nanometer, which are typically the spherical shape or nearly sphericals. And there are one dimensionals, all of you know, the CNT, I mean, is X and Y is confined, and it has only the Z, which is the length of the carbon nanotube. Similarly, nanofibers, there are silicon, germanium, and so on. So nanofibers, which are solid, and the CNTs are this empty, is kind of a cylinder. And then there are two dimensional, which has definite x and definite y, and then z dimension is confined. That's what it is called as the two-dimensional filler. And layered silicates, which is available in many of the mountains, and our country is fortunate to have a lot of silicate materials, and they are very good. I will be talking about them, which are extracted from the mountains in different parts of the country. And then there are another three-dimensional fillers, so where there is no confinement, and but as though it is some micron size, but not in the nanometer dimensions. So they are 3D filler. And the good example is the catalyst, like this material, where these polymer molecules can go inside and everywhere, and it can form these composites. So all of these nanofillers, they embed into the polymeric system, and one can get the polymer nanocomposites. Then let us come that what are the fundamentals of this composite, and then we will go to the preparations, properties, and the applications gradually. Okay, so let me just talk about the very basic things about the nanocomposites, but they are very important. The driving force for um, making this subject as the research one, why, what is the need of understanding and manufacturing the composites. So the nanocomposites actually they started in the early 90s. First paper is from the Toyota. They try to develop the timing belt of their vehicles, and that's what usually it was made of asbestos and which are a bit toxic. So they try to replace it with the polymers, but the polymers, most of the polymer, the HDT and heat distortion temperature uh, is low. Heat distortion temperature is defined as the temperature up to which there will be no change of a shape and so on under a specific load. So then most of the polymers have the HDT below 100 degrees centigrade, and engine belt it goes beyond 100 degrees centigrade. So Toyota was looking for certain things that which can HDT or heat distortion temperature should be above 100 degrees. That's the driving force for Toyota to look for new materials, and then they'll end up with the interesting polymer nanocomposites first time in this in the world. And then they are applied the many parts, of the car, and including step chassis, some of the bumpers, and nowadays, and there are in Europe, this is the barrier properties are being utilized to store the beer or any beverage for longer period of time. I'll talk about it, and electronics packaging, a lot more things. And nowadays, uh, it is being applied to many sports like designing the balls, lawn tennis balls, and other things made of composites. Previously, what people used pure polymer. Nowadays, polymer is uh, the polymer is actually instead of polymer, people are using now the polymer composites or nanocomposites, which have much better properties as compared to the pure polymer, right? Okay, and these are the other the applications. There are huge applications. I told you that engine cover and timing belt and parallel protection wear, and the lot of cosmetics things where the barrier properties are very important to store the material. I told, and any shampoo bottle and other things. And then I told you that the balls which can withstand or keep the high pressures inside for longer period of time because of the barrier again. And and the nowadays tubeless tire is very popular and being used in most of the vehicles, all made up different nano reinforced polymers. There are different types of polymers starting from natural rubber, polyurethanes, and different types of polymers are used. But main important part is that okay, it's the polymer is being replaced with the polymer composites. First, there was a replacement of ceramic and metal with the polymer, and then metal, then the polymer is being replaced with polymer composites with the superior properties. That's the driving force of gradual improvement of the materials point of view of the soft material called the polymers. Now, let us just try to understand whether the nanocomposites, nano is a very fashionable word nowadays. So, trying to understand the buzzword, how it is effective and why it is effective. And so the composite is basically the mixtures. If we have a matrix and we put certain fillers into it, and the main thing is, say, the interface of the two components are very crucial because they only interact between the two phases, and then these interactions or the overall interactions is responsible for the property improvement. And now, if we try to see that how, if we reduce the size of the filler, big size, moderate size, and very small size, then what are the changes? The surface area that do changes, that surface area by volume, surface area is 4 pi r square of any sphere, and volume is 4/3 pi r cube. So it is 3 by r, and if we reduce the R, and then specific surface area per unit volume will increase. That's the important aspects. So as 1 upon r will increase if we reduce it from say micron to nanometer. So there is 1,000 times improvement of the surface area. And if we improve the surface area, and then you can understand the interactions or overall interactions between the filler and the matrix will get enhanced like anything. Say 3 orders higher in magnitude. So if we do it from micron size filler to the nanometer size filler, that's the essence of the composite or nanocomposite science or nanoscience in general, which enhances these properties of the matrix polymer. Okay. So I think just let me tell you, I mean, if you feel free to ask me any questions in between, feel free to ask that. And so I'm that even I will understand that it would be more interactive even if you need any discussions or something, some clarifications. So I'll be happy to do that. Okay, and then and depending on the different chemistry of the nanofiller and the polymer, say polymers are polar, non-polar type, fillers are also similarly polar and non-polar. So the overall interactions, as I told you in the last semester, that the surface area and these interactions. So now I talked about surface area, and now it is interactions which play the role of making the polymers nanocomposites of various types. One is if their interactions is quite low, which is known as the conventional composites, and there is a big clusters of the filler and surrounded by the polymer. So overall it's a composite, but it's a conventional composites like tire and so on. Tire is a conventional composite where carbon black of 40%, tire consists of 40% carbon black, and that is the reason why the tire is so inexpensive still now. And then if we improve the quality of the nanofiller through by surface modifications and so on, and then the interactions with the polymer get increased, and then polymer start going inside the layer of the structures, and which is known as the intercalated one. Intercalations means it is if it is a two-dimensional filler, and between the filler the polymers are going inside, and it makes intercalated structures. And if the interactions are too much, and then the lot of polymer will go inside, and they will delaminate or uh, or push apart the two neighboring layers, and then it will be exfoliated one. And both the exfoliated and intercalated is usually known as these nanocomposites, and this falls under the category of the conventional composites, where the size of the clusters of the filler is big. That's the only difference between the conventional composites and the nanocomposites. Okay, and so let us then come to this area and how we can make these composites. There are several ways. First one is the solution route, which is being utilized in a laboratory or the research purpose, where the polymers are soluble in some solvent, and put the fillers into them and mixed nicely using sonic acids and other things, and then evaporate the solvents, and then you can disperse nicely the filler into the polymer in the polymer matrix. And then other routes are melt blending, which is being done in a machine called the extruder, where the polymers are bring to a high temperature, depending on their nature. If it is amorphous polymer, Tg plus 100 degree, or if it is crystalline polymer, Tm plus 20 degree or 30 degree, depending on the polymer. So they are mixed together, and then from at the end of this one, under huge CR, so they are coming out after getting mixed within these systems. So this is another technologically viable systems of producing polymer nanocomposites. And the people are, I mean, nowadays the technologies are heavily depend on these extrusion techniques for getting the polymer nanocomposites for practical applications or in large scale applications. Solutions are the solutions, and I will talk about the in situ method, latex formation. So they are the laboratory methods or research grade one, and melt blending through extrusions is the industrial one. And in situ techniques, is monomer are mixed with the filler, and then sonications for better dispersants, and then monomers are polymerized where the polymers can cover the fillers to form the composites. And then there are the latex formations, so where polymer dispersion in water plus filler, which is kind of a freeze drying is the technique where you can condense the whole systems at very low temperature, typically -20 to -80 degrees centigrade, and then take out the solvents under evacuations. That's the freeze drying techniques. That is another techniques of preparing the composites. So there are several techniques to prepare that in lab scale or in the industry scale. And now there are fabrication techniques. Now we have prepared the polymers or the composites of polymer, and then fabrications is the where we need to have a kind of a say a device or items from the polymer, and then these are these things, the weight layup techniques and prepaid layup. So I'm not going into these details of these processings. And the processings basically give a particular type of item that we like to have. I mean, we can fix the XYZ, what is their dimensions and so on, and then we can do it through several means of fabrications, say press melting, pultrusions, and so on, which will give uh, the particular shape and size of the product of polymer composites. And then let us try to understand at the molecular level. I mean, if we disperse a filler of 0 dimension, 1 dimension, and a 2 dimension, and then let us see that how do they look like. So this is the TM image of the 5% silica particle, and here the typical dimension is around 30 nanometers or so. So they are nicely dispersed. It is a TM image of the silica composites. And this is the TM image of the CNT, where 1% CNT is dispersed nicely into the polyethylene matrix. And here, this is the clay or two-dimensional layered silicates is usually called clay because it's basically the mitti, which we call it in Hindi, and available in different mountains, and they are dispersed in the polymer to get this kind of structure, these, and these, and all three of these are the clay add different polymers, and the difference is huge. Here you can see these clusters, and here very small and oriented the silicate layers in the polymer matrix. And the reason is the specific interactions between the polymer matrix and the nanofiller. And they are very high here. In these two cases, they are high, and here it is low. This is polyolefins, and so it's low. The non-polar but the polymers are having the lower interactions with the moderately higher polarity of or polar nanofillers, so their interactions are less. And here it is the nylon 6, and which can form strong hydrogen bonds with the polymers, and as the layered silicates have some OH group at the edge, so they can form hydrogen bonds with the polyamide, which is the NH group in the polymers. And so from these to these, it occurs through these processing techniques by through the sliding mechanisms, and it has been shown it here that how the clusters in the initial form of these the nanoclays is in the cluster form, and how they are break up and form this kind of oriented structures which show very high mechanical strength. That's the important aspects why the pupil the prepare composites instead of the polymer, pure polymer, because its mechanical, thermal properties and other uh, properties are very good. Okay, and then I will be just some energy considerations of this level of dispersion. I just told that in order to have a single thick layer, two individual layers, and then one single layer can be possible like this one. So that energy considerations that I have shown it, say the total energies is the surface energy plus internal energy same depending on the materials used. The surface energies which are basically changing because there are new surface area that are being formed when clusters are slided and form this kind of structures. And that's the we have shown it that okay, I mean how much energy are required to disperse these the cluster of the filler to the individual layer. And in order to do that, we need to do work on the systems from the thermodynamic point of view, or in terms of the processing techniques, we need to work on the systems through the processing techniques by applying high shear force at high temperature. Temperature is given, so it's the polymer becomes liquid state, and once it is liquid state, and then we apply the high shear in order to have the delaminated structures from this to this. That's the basic fundamentals of the energy considerations, because we are creating huge surface, and in order to do that, we need to do this specific surface energy per unit volume to the systems, and which are given to in the systems through the electrical heat. That's the how the surface energy are created. And in order to create these surface energies, and you have to have high temperatures to provide it, and then you are supplying energy, so energy is consumed or conserved. And then once we prepared and process and understand the thermodynamics of these composites, and then let us try to characterize the polymer composites. And there are the three types of the characterizations. One is and how much nanoparticle we put, and can we visualize them under electron microscope or other spectroscopic techniques. And is there any change in polymer matrix? Sometimes nanoparticle influence the polymer matrix, which is the induced phenomena. Nanoparticle induce the property of the polymer, and then it is the induced phenomena. And there are these things are all known. I mean, the any characterizations, basically the structures, different types of X-rays, wide angle, small angle, can be useful for getting the structural aspects of the polymer composites. And morphological, starting from optical, POM is the polarized optical microscope, and SEM and TM are the electron microscope, and the surface morphology through AFM, atomic force microscope, and so on. And then spectroscopic techniques are NMR, IR, UV visible, and Ramons are good for understanding the spectroscopic studies of these composites. And then the which will tell the interactions, especially between the between the filler and the polymer, that is obtained through the spectroscopic techniques. And then the optical, also the UV visible photoluminescence and the other measurements is possible. Thermal property through glass transition, temperature through DMA and TMA, and thermal stability through TGA, thermogravimetric analysis. And mechanical is a very part of the characterizations of the polymeric materials or any material in general. UTM, universal testing machine, DMA, dynamic mechanical analyzer, rheometers, and so these are the mechanical measurements. And there are some thermomechanical. DMA is thermomechanical, so simultaneously thermal and mechanical measurements are possible. And then the final one is the barrier properties, which basically calculate the permeability of any gas through the membranes or the polymer sheets or polymer nanocomposite sheets. So I'll be talking about first the nanoparticle characterizations. So here is a good example where titania can be in two phases, anatase and rutile phase. And so this is the structures of these rutile phase and anatase phase of the titania. But if they mixed into the polymers and they are exclusively anatase, even the rutile phase is mixed into these polymers and it's the nylon is the polymer. So that's one a good example that you can stabilize the structures of the titania that we want to have. And so this is the X-ray methods of doing the nanoparticle characterizations. And then similarly, the Raman shift can help under understanding what are the different modes, so the S band, G bands, and so on, so on. And then we can find it in the composites as well as these pure CNTs and so on. And then IDEX is the technique to understand the different elements present in the nanofillers. And the techniques is here, okay, I mean silicon, aluminium peaks, strong peaks, and so on. And quantitatively also is possible. But the IDEX is not a very good method. I mean, instead, see the ion spectroscopy or the ion chromatograph are the better techniques to understand how much elements are present and in which states and so on. And there is another techniques to calculate that how much polymer is going between the layers of the silicates. And this distance is basically the 0, 0, 1 peak, x and y is 0. So this is basically the distance between the two consecutive layer, which is called the planar spacing. And if we do the X-ray of this, we will be able to get, say, if we add, this is a polypropylene and clay composite. So where clay is dispersed in polypropylene of different amount. Say here 7.5 is the amount of the clay, 4, 2, and so on. This is the polypropylene. Polypropylene has no peaks, but the clay has a very strong peaks at this one. And interestingly, and this as the amount of clay lower down, and then there is a gradual shift of the peak positions. And this is because if there are less amount of clay available, more and more polymers can go inside. And then it will be highly intercalated, or lots of polymer molecules do exist or lie between the two neighboring layers. And that can be, one can obtain the D001 from the Bragg's equations. One can get the spacing as a function of crystallization temperature. Crystallization temperature, that's interesting. I mean, and at which temperature we do crystallize, that actually matters how much polymer is going inside the layers. And these processing techniques are useful in getting the varying mechanical strength polymer composites. That's the different aspects or interesting aspects of the nanocomposites. First one is the, I mean, you can choose a right kind of nanofiller. First thing. Second thing is the content that, okay, you can use 2%, 4%, but usually people find 4% is the optimum percentage, which show better properties in terms of all the properties, say structures, barrier, and so on. And then of course the mechanical one. And the third thing is, one is the type of pillar, second one is the amount, and third one is the processing, at which temperature they should be processed to have different de-spacing, and so that their mechanical strength would be very different. So let us go there, that how. Okay, so before doing that, I mean I will okay, so I will first talk about this one, and sorry, this mechanism of the crystallization rate as a function of temperature. So at a optimum temperature, crystallizations are very high. Very low temperature, close to glass transition temperature and melting temperatures, they are very low. And depending on that, so the polymer mostly will be in the liquid state, so they can go inside the layer, and then we can have different type of microstructures. And here very small polymer go inside the layer, large amount of polymer inside the layer, and then here, I mean, so large that amount of polymer between the layer that they push apart the neighboring layers. And based on that, interlayer spacing do changes opposite to these the curves. That's interesting. And this shows, okay, the interlayer spacing do change depending on the crystallization temperature. And how does it affect? Let us see the mechanical strength of this one. Yes, and I've shown you these things, and we measured these spacings, and then how we have generated this kind of microstructures. And then if we measure the mechanical strength, we see at this mechanical strength is much higher, and it is this as compared to this one. Because here less polymers are go inside, more amount of, or the larger quantity of polymers are going inside the layers, which enhances the mechanical strength of these same polymers. So through processing techniques, one can able to enhance the mechanical strength of the composite. That's it. This is why that these techniques are used. This is a DMA result. So where the modulus as a function of temperature is obtained, and the samples is here. The sample is here. This sample and this sample show very different mechanical properties as observed from here to here, and at least 2-3 times mechanical property enhancement occurs in this case. Okay. And then here I'll show you that the first part of the characterizations of the nanoparticle and then polymer. And here this is a case where induction phenomena is observed. Say the nanoparticle help inducing particular phase in the polymer. So the nylon is crystallized in the alpha phase, and it has 3 distinct peaks. But if we put the nanoparticle here, 3.7% of the clay in the nylon polymer, and then it shows only the gamma phase, or the gamma phase of the polymer is stabilized in presence of 3.7%, so nearly 4% of the nanoparticles. So this is the induction phenomena. See, the nanoparticle induces a particular phase of the polymers, and then there is huge change of the morphology. Alpha, it is clearly the spherulites are observed, and in the gamma, and it's very tiny needle-like morphology, and I will show you. And because of this needle-like morphologies, these extensions are quite high as compared to this. Extensions means the ductility is very high, or it's very tough as compared to this material. That's the development of using the nanocomposites as opposed to the pure polymer using the using the conventional or using the natural clay obtained from these mountains and so on. And we tried to understand that, okay, what are the things that the Toyota actually prepared these uh, the uh, the materials, composites, and they tried to understand what are the reasons behind the huge improvement of the HDT. HDT improves, say, uh, from 60 degree to 150 degree, almost 100 degree HDT improves of nylons, which are good enough for using as a time belt or the engine covers and many parts of the car. And the reason is this. This is the TM image of the polymer clay composites, and if we zoom it one thing, so we can see it that, okay, we have the nano clay like this, and on top of these, both sides of these, there are polymer which is crystallized in the gamma phase, because the X-ray says it is the gamma phase, and the gamma phase is because of this. So this is a kind of a sick kebab structures through which there is a epidaxial crystallizations which provides very high mechanical and thermal properties of the composite as compared to the pure polymer. And we have mechanistically show this one, that, okay, this is the silicate and this is the nylon, they form hydrogen bonds, and which gives the scale like structure. So this we have measured, this is around 9 nanometers, so around 7-8 layers are formed. So one layer is this, so one this is kind of fish scale kind of structures. This is one fish scale. So middle of this, you have another NH bond which can form hydrogen bonds with the next molecules. So that has been shown it here. And this molecule has again at the middle there is hydrogen bonds available and so on. I mean, so these hydrogen bonds can be extended, but that cannot form so long, and there is a limit because its influences are quite low then. That's what there is a limit of this one, the physical scale structures or Sikabab structure. Okay, and then I told you the mechanical properties improved a lot. This is another systems, the nylon 6 and at different temperatures. But another interesting property of the permeability, which is responsible for storing the food and beverage for a long time. And I think Coca-Cola, all of us can remember, there is, the shopkeeper cannot store it for more than one season or so. But now the Coca-Cola is can be stored, and because of this, the permeability enhancement of the bottles we use, which is the PET bottles, and then use of around nitrogen permeability is very high. And if we use say almost half of the permeability is observed, say at least if we 1 year only the storage time, and now we can store it at least 2 years or so using a very minute quantity of silicate. Okay, so I will skip this one. I will go to the optical properties of this, as they are, the nanofilar are nanometer in dimensions and much smaller than the wavelength of the light, and so light can pass through the pass through the composites easily and making the system transparent. And if the polymer is transparent, and then the composite is also transparent. But if they have any absorption, like if we put CDA, CDAC, they have the particular absorption, and then they can be visible in the UV patterns or so. And then the barrier properties, I just mentioned that, okay, I mean, now we have the systems where the like card or the cold drinks or the alcohols, they can be stored for a longer period of time. And the reason is very simple. If it is pure polymer, so the oxygen is actually the main culprit, which goes into the systems, and then the bacteria can grow over there. And but if we have the nanofiller, so they have a tortuous path like this, and the tortuosity enhances the barrier properties of the composite systems. And this is very high if it is a two-dimensional filler as compared to the zero-dimensional or one-dimensionals. And you can understand if you have a, I mean, just like my hand, and if it is this, and then it has to go this way and then pass. But if it is this one-dimensional pillar, and then immediately it can pass through. So two-dimensional pillar or the layered silicates are much better species for controlling the barrier properties of the composite material. And okay, I will skip this one. This is the mathematical formulations of the barrier properties, how they can be modified and so on, the functions of the volume fractions of the nanofiller. And then there are different models, and Bharadwaj model, Nielsen models, and so on, by which one can state what is the order parameter of the clay or the nanofiller is important, and if they are aligned in one directions, and then perpendicular to that direction or orthogonal to that directions, your barrier properties are high, which is required for most of the applications. Like I told that protecting the cold drinks using this one. I mean uh, the length of the bottles, that if that is the x-axis, so our filler should be oriented in that x-axis, and then we will be able to have higher barrier, and we will be able to protect the beverage for longer period of time. And there is another the fire properties also. I mean, fire properties are very important for the stadiums and so on, where the chairs are made of the fireproof chairs, people call, and they can be made of even nylons and other things. But pure nylons, this is the heat release rate, the cone calorimeters, and how much the oxygen is the supplied to it if it is burned, and then how much heat is released, and that is heavily affected if it is the pure nanocomposites. I will show you morphology what happens. And so heat release rate in the composites is very low, so it will burn after say tens of or tens of hours, and before that I think people come and um, the control the fires in the stadiums and so on, as compared to the pure polymer, where the burning rate is very high and quick. Okay, this is just the data of these composites and how the heat release occurs as a function of time, and the compositions of the nanofiller. And maybe okay, these things I wanted to tell you these things, that I mean how the heat it acts as a heat barrier. So if we burn, and then this is the clay, this is the surface which is get burned, and then this is the nanofiller, which are the inorganic in nature, and they will not allow the fires to go in, so your interior part is as it is, so it is not ablazed. Yeah, this experiment is done, the ablation experiments. So that tells the fireproof nature of the material if we just put say few percentage of the nanofiller into the polymer matrix, and that do this job. Then we will go to the other properties like wear. Wear is extremely important for the tire, and I mean I think all of you observed that maybe if a vehicle move very fast and if we have a sudden brake, and then the roads become black because of the frictions between the tire of the vehicle and the road. And this is because at high frictions there is a evolve of temperature, evolution of temperature, which damaged, and the result is the wearing or loss of material from the tire. That is called this wear. And wear is can be controlled by using nanocomposites here. You have seen this is the unmodified clay, this is the pure polymer. There is huge wearing effects. You can see this unevenness of the surface, and but here it is quite smooth surface. So if we use this composite tire, and then wear effect is very less, or in other words the durability of the tire would be more. This is just by simply by putting few percentage of the nanofillers and processing techniques, and that's do this job. And here is another is the surface erosions. If it is plasma treated, and that is the phenomena which is being done for sealing of the cards and other things. I mean, Amul and other things, they seal the card using this plasma and make it a seal. Here the pure polymers, so they also do this job, but there is huge shrinkage occurs. But if it's a composite and after the plasma treatment, so there is no shrinkage or very less shrinkage of the material. And that's the, I mean, you can take the original size after a finish, and before finish is almost the similar, so there will be no problem of the shrinkage of your cover. So this is how the different properties are controlled using the nanocomposites of the polymer as opposed to the pure polymer. And then mechanical properties, there are different types of mechanical properties, and like UTM, DMA, dehumidifier, hardness, impact, or most of the cases impact, hardness, and the mechanical strength do increase if we just put certain amount of nanofiller into the polymer matrix. Okay, I understand that maybe some of you may or may not like, I do not know, I mean, how many of you have the chemistry background. And here, okay, I will not go into these details. Here is the synthesis of polyurethane chemistry, where the diisocyanate and the diol, they react and they can form the isocyanate chain ends, and which further reacts with the diol to have a long chain molecules. This is a versatile polymers used in many industry, starting from adhesive industry, and then all of our, I mean, the pillow and Gadda, Rizai, and everything, and the Carlons, and the company name, they are better product. All are polyurethanes, cushion materials, and so on. I mean, so all these things is possible if we do the changes, the slight chemistry of here and here, and then we have a several types of polyurethanes, and which will alter the properties by changing the segment, hard segment content and their chemistry, which alter the properties. I mean, this is in brief, I can tell. Say individually, I mean, if we have a benzene ring, rigidity comes into play. And if we have certain kind of ether linkages, and that brings the flexibility. So we have both the rigidity and flexibility, two opposite things in one go, so that it will have a flexible and a tough material. That's the important aspects, flexible but tough material. And we had some theoretical calculations that why do they show very good properties, and it shows there are strong hydrogen bonds between the molecules. So that's what they form, kind of a layered structures. And the layered structures, these are the molecular layer. So they form hydrogen bonded structures which are affected in, I mean, a series of experiments that I will show you this. I'll show you. Okay, sorry. Here I will show you this here. I mean, if a very small or couple of molecular layers, they form a kind of a greater layer, and then that can be formed or that can be detected from the XRD, and which is typically the 1 nanometer to a few nanometers. And if we do the sense or the small angle neutron scattering, which can tell this distance between these two is around tens of nanometer. Here, I mean, in our cases, it is 12 nanometer. And but these structures formed, few of them form a extended adduct, and that is this one. So that is this one, single one, and few of them extended again to get this kind of things, which we can get it from FM, where the structures of size of 0.6 or the micron size, and all of them are together here, which is having the 5 microns, which we can get it through optical microscope.
Sir, voice is not audible.
Compilation. Please, I mean, if you have any questions or queries, please let me know. Is there any? Okay. Okay, so all these four the instruments can tell you that the gradual self-assembly from the molecular layer to the thick layers, which are observed using the optical microscope. Okay, and so I will skip this one. And one interesting part I will be telling you this one, that while we are making the composites, say this is this clay or two-dimensional clay, sorry, and if we insert one part of the polymers, that is the diol, so we are putting it, and X-ray tells it's the spacing changes 1.8 nanometer to 4.2, and then we insert another chemical which is diisocyanate. So the diisocyanate react with these things, and then we can show this product here, and which increases further the spacing between the layers. And if we react further with the butanediol, another diol, and then there will be a huge polymer between each layer, and then that will push apart the individual layers, and this shows the delaminated structures. So the composites are a good way of getting different kinds of the microstructures of the polymers and the nanoclay. So all of them show very different self-assembly behavior and the mechanical strength. So based on that, one can have a control over the mechanical strength of the polymer. And second thing, we will be going to the biomedical use afterwards, and then they can be very good for restoring or keeping the drug for a longer period of time using this kind of class charts, so from where drug will not be released easily, and we can get a sustained release. So that I will be coming later, that so, but just I wanted to tell that, okay, we generate the microstructure purposefully in order to make use of it as a controlled delivery agent. Okay, so, and then, okay, so these are the experimental techniques that I just summarized there, these things. And this is the experimental evidence from the X-ray, neutron scattering, and we can find the different the the spacings level and AFM also, and then the microscope, optical microscope, which talks about the greater assemblies of this. So I mean, if we see a single one, and between these we can see this kind of structures, and between these we can see this kind of structures, which is we got obtained from the small angle neutron scattering and the X-ray scattering. So here is the another system. Just like I told you, there are lots of chemistry one can do by changing the chemical nature of the diisocyanate or polyol, and then one can do the lots of chemistry of this one that do changes the dimensions and the morphological observations of this. So this is the another important part. Just I mentioned it. I mean, if we have very different type of microstructures, and they show very different the mechanical strength. So this is a brittle but high strength material, and this is ductile but a little bit little low strength material, but this is at the highly tough material. So we can have a high strength material but brittle, and we can have a little bit low strength material but ductile material. That's the optimizations can be done by embedding a few percentage of the nanoparticle in the polymer. And the ways this, I mean, the chemistry or the polymerization techniques are bit different, and then one can able to do these things. Okay, so these are the rheological things, so I will not go through it, which talks about uh, the relative strength and the splintering phenomena, and if you apply the different the frequency, and then it shows very different splintering or splitting of these the nanoparticle orientations. Okay, so these are the rheological behavior of the polymer composites, and which basically the ordered pattern to disordered pattern it shows after this the splintering phenomena occurs under a high frequency. Uh, Here I know maybe okay. So here is the another composites where the nanoparticles are embedded in polyvinylidene fluoride, which is a fluoropolymer CH2CF2. This interesting aspect is if we put 4% of the nanoparticle, it shows tremendously high mechanical strength or the toughness. So it is so tough, and then it can be used as the the materials to cover up for these things. But another important aspect is it is a piezoelectric material. So X-ray shows it is the alpha, and in presence of the nanoparticle is converted into the beta phase. So the beta phase is piezoelectric because of the alignment of the dipoles of the molecule. And these are the characterizations of the SEM and the optical microscope, which tells that needle-like structures again formed because of the beta phase. And this beta phase is responsible for high mechanical strength, including the toughness, and it is piezoelectric. So this property will be utilized to form the different area of energy generations and so on. And I will not go to this one. We try to understand that what happens when it is traced here and here. We see this is basically the orientation of the nanofiller under the force field, and then the small angle X-ray scattering tells okay, so orientations occur very significantly in nanocomposites as compared to the pure polymer. There is no significant orientations, but here there is huge orientations along the force field. And then another aspects of this is the foaming, and polymeric foams are a very important part of designing different types of carpets, especially used in these winters season. And then the polypropylene or the polyurethanes, the foams, they can be prepared. And we have shown these the foam structures as a function of the clay content. Say high clay content is no good, but optimum 2 and 4% is very good. So this is the best the clay content foam. And then mechanical strength also increases abruptly, maybe 5 times almost from here to here. Right? And then we understand the reason behind it. What does this nanoparticle do? So this is the one single cell, and if we see it under the electron microscope, we see the structures. So these are the 3 parts, 1, 2, 3. So this is something like here 1, 2, 3 parts. So this part we have seen it, and there are orientations of the nanoparticle along the polymers line. So these are these empty space. This is a foam, so this is empty space, and this is the polymer line only. Usually they are hexagonal, pentagonals, and so on. So these special rearrangement actually enhances the mechanical strength of these polymers. Okay. I mean, these are the similar things. So I will skip this part, which talks about the intercalations, and but in the other systems, intercalations and the mechanical strength. Okay. So then I will show you that how these nanofillers are showing the um, controlled biodegradations. And maybe biodegradations, if we put the nanoparticles, say like PLA, and if we put 2 different clay, in this case it is salt, calcium salt and iron salt, so biodegradations can be improved and can be lowered down also. And both things are required. Say if we use a plastics and single-use plastic, then we should have a very low biodegraded time. The time should be low, or biodegradation rate should be high. But if we use the same polymers for the shampoo bottles and other things, we should have slower biodegradations, and that can be possible. And we try to understand, so what are the reasons behind it, and knowing the facts of relative biodegradation rate through morphologies and uh, actual dimensions of the plate. Or we may take plate, and then we see that how the plates are getting broken as a function of time. And then we understood the reason behind it, that different pH is induced by supplying different iron or calcium salts, and they are responsible to activate uh, the microbes or the enzymes in particular. And then that enzymes are reactive for breaking down the molecules of the polyesters and so on. So these are the controlled biodegradations are possible by applying or by putting the suitable kind of salts or the fillers into the systems. And then another things is the ceramic foams. And ceramic foam is difficult to create, but if we prepared a polymer composite, and then if we burned out the polymer composite, then at around 600 degrees centigrade polymer goes off, and then we can have a ceramic foam of this type. And if we use the a nicely dispersed system, and then it shows very good foam, as opposed to the if we have a not dispersed system, very nice dispersed system, so this is going a very bad foam. Okay. Okay, so these are these applications, and then I will be okay, so I will be, can I take maybe a few minutes break before we move to the part 2?
Yes, sir.
Okay. Maybe 5 minutes.
Yes, sir.
Okay, okay then. And if you have any queries, please feel free to ask. Okay, then we will meet again after a few minutes. यूजीन का डिटेल्स मिल गया ना। हाँ, उसको करा दीजिए। Oh, okay. So I am back, Amina, and maybe if you have anything to say or
Yes, sir.
if you have any queries or anything, please feel free to ask or other things. Or otherwise, I'll go to the part 2, the application part of the polymer composites for biomedical use.
Yes, sir. You can continue, sir.
Acha, okay, okay. So the part one, as I told you, is basically the basic concept of composite and how they are prepared, their structural property correlationships, and so on. And then the second part is the applications. I mean, we applied in the two area mostly. One is on the biomedical area, especially the drug delivery, and another is the energy area. So utilizing this concept or the basic things from the composite, so we are applying these polymer composites for particular application. So here, we prepared a bone cement. Bone cement is basically uh, when a bone breaks, and then sometimes the doctor put a metallic implants. So these are the metallic implants, and there is huge friction between the metallic implants and the bone. And in order to avoid that, doctors put some the grouting material, which is the bone cement. Bone cement is nothing but the PMMA, or the perspex, which we call the same material which makes the window pane and window. Now the glasses are being replaced with the PMMA polymers. And so PMMA is being used, and most famous one is Johnson and Johnson's, who prepared this bone cement. But that has a very long durability. The reason is PMMA is brittle material. So what we did, we prepared a composite of this same thing by putting few percentage of the clay into the bone cements, and then we prepared a kind of implant like this one. This is metallic one, and then we applied the dynamic force, which mimic as if we are walking freely. I mean, then our hip or knee and are getting the kind of force of our body, which we called as the gait cycle. So the gait cycles are measured under different force. Something like, I mean, if it is a baby, or if it is adult, or if it is uh, I mean, thin man or fat man, and so on. I mean, and then depending on that, the cycle depends. So if it is very high load, and then nanocomposite can withstand only, but a pure polymer are broken at lower loads. That's the one important aspects. And then we keep the same force, something like 3.5 kilonewton. And let me tell you, I mean, normal body weight persons, say 70 kilo, the sigma is around 1.8 kilonewton. So we just keep it double to understand the efficacy of our material. And then the number of cycles at it withstand before breaking is very large as compared to the pure polymer. That's the development of the applications of the bone cements for the biomedical uses. And then we try to understand what are the reasons. It is almost driven by the morphology, and which is not a brittle morphology like the pure polymers, which is basically a flexible uh, matrix, which are responsible for very high gait cycles of the material. And then the composite material, this is a very good thing that our in this country, in the Rajasthans, there are certain clays available. So those clay are very good as compared to the imported clay from US and so on. I mean, that we have done this experiment of bone healing. So what we did, we took the rabbit. This is experiments on rabbit, and we make a holes here, and the control it is there, and the similar holes size is fixed around 5 millimeter size. It's a hole, and then we are creating using a borer, and then we are applying the material control. There is nothing, only saline water and then bone cement, which the doctors nowadays apply. And this is imported clay, and this is our development of uh, this is the Rajasthan based clay, and we took help of another institutes to surface treat it, and then we prepared the blends, and then we apply it here. And then we see it, see the here using the Indian clay, the bone healing is remarkably good, and it just heal in 30 days. While in the imported one, it is not healing at all, rather it is infecting the whole bones. No? So there is, you can see it, there is huge infections, which is more evident from the histopathology. If we see these things under the microscopy, and then this yellow part is shows the infections, and this red part is from the new bone here in this case. That's the difference. The present surgery systems which heals is actually 60 days, which is reduced to 30 days time using this composite route. That is the second the evidence of these composites as the superior material for biomedical uses, and in this case it is the bone healing. And the other the materials we used as the say this is some kind of scaffolds. The scaffolds is made up chitosan and this material, and you use the chitosans is naturally occurring polymers, is usually available in crabs or prawns. And this material, we do a few chemistries on this to suitably modify it to form gels or scaffolds. So the scaffolds are like this, so which is highly porous material, and the bone can grow onto the porous material, and inside the pores cells can grow easily and very nicely. They are biocompatible material. That's the material we had applied into 30B clay and make composites of this one, and then we applied for bone healings because sorry. सर आपके साथ आधा घंटा बाद बात करेंगे, हैं ठीक? हाँ, ठीक हाँ हाँ बात करेंगे सर, ठीक. Oh, I am sorry, I had a emergency call. Okay, so mechanical strength in presence of the nanoparticles are high, and they are biofriendly and help in bone healing, and that is been shown here. This is controlled after 8 weeks. There are still bone to heal, but in this composite case, they healed it very nicely. So these are the advancement of the composite. Sorry, of the composite over the pure material. And even this is the say only if we use the chitosans, and then still there are some small holes after 8 weeks, but in this case they completely heals after 8 weeks. So then we try to understand through the cell biologies and so on what are the reasons behind it. Basically, as I told you, there are a lot of holes or the porous structures which are favored in presence of the nanoparticle, which are more biocompatible, and then the cells can grow easily, so that their bone healing abilities are high as compared to the pure polymer or the control. So this is the third example of showing these things. And other applications of this composite, we have shown it through the sutures and the stent. Okay, I have shown it in, it will not go. Okay, I had a video, actually 2 video. I'm showing it in different computer, it will not work. But anyway, so the basic thing is we developed some sutures or the stained materials, and based on this shape memory polymer. So shape memory polymer is, say, if we have a polymer strand, and if we give a shape of this at a particular temperature and we freeze it at 5 degrees centigrade, and then if we bring it at room temperature, then it will open it up. So this is the same memory. And pure polymer, it opens up but not very clearly, so this still there is some angle. But if we put the nanoparticle, if we see do the same job here, and it opens up clearly, or its same memory effect is enhanced in presence of the nanoparticle. And this is just the opposite demonstration. And we have a spiral samples, and we freeze it at 5 degrees centigrade, which is called as the temporary shape. And then if we freeze it at 5 degrees centigrade, if we bring it to 40 degrees centigrade, it will take the shape of the spiral one. That's the shape memory effect. And this I'm not going inside the science behind it. Is basically kind of the molecular movement which is responsible for this same memory effect through crystallizations of the polymers. And the nanoparticles actually the help in crystallizing it, because there is a surface area on which polymers can crystallize nicely or easily. So I'm not going to the high temperature X-ray or neutron scattering setup and this one. And then the demonstration part or the applications part we are showing. So we make a cut mark in the animal, the rabbit, and then we sew it using our strip. And instead of pulling it, what we did, we apply very small heat using the hair dryer. So the temperature of the hair dryer is something like around 40 degree, which can any animal, including human being, can withstand. And because of the same memory effect, it is squeezing it down, and we have a time dependent structures or time dependent image. After 6 seconds, it squeezes the whole cut mark without giving pain to the animal. I mean, if we mechanically stretch it, and that's the huge pain after sewing we experience when the doctor do this job. But in this case there will be absolutely no pain, and it will be automatically squeeze it down. That's the same memory effect of the sutures. And then the same material we applied for the stent also. Stent we have demonstrated in this manner. So we have a uh, cylinder and a hollow cylinder, and in which we put our shape memory material like this, and we put like this one. And then at 5 degree we froze the same memory polymer. And then if we bring it at 37 degree, it memorize its previous shape like this, and then it is show the cover the whole cylinders and act as a stained materials. So the two view we have shown it here. Here there are a lot of space, and it has expanded and almost covered the zoom one. So this material or the composite material is working as a very superior sutures and the stained material based on the shape memory polymers. Okay. And then let us go to the other and we are mostly working on the cancers, the drug delivery for the cancer. Here there is an example that okay, we have a the cancers, the biggest problem of the chemotherapy, the patients undergo huge pain or nausea just after the chemotherapy. The reason is high dose of chemotherapeutic agent is given, as the drugs are not going inside the cell because of the electrostatic repulsion of the negatively charged cancer drug and negatively charged cell. So they repel each other, and the cancer drug usually do not go inside the cell. But if we do is we need to design a vehicle which can promote this delivery of drug to these systems. The nausea and loss of appetite, hair loss of the chemotherapeutic patients is presumably because of this effect of high dose of anti-cancer drug and low level of cellular absorption, which technically it is called as the cellular uptake. cells cannot take up the drugs. That's the reason behind it. So what is, we design the vehicles based on these concept of composites, and we have a layered double hydroxides, and they are positively charged and negatively charged, counterbalanced counter ion is there, which is usually carbonate, nitrate, or sulfate, and so on. What we did, we replaced the negative anion with this drug, raloxifene, which is the anti-cancer drug, and is negatively charged. So they replace the anions here and take up the shelter within the layers. And then we can have X-ray of this one. So this is 0.85 to 1.35 nanometers increment in the spacings. That tells, okay, there are a lot of raloxifenes, anti-cancer drug within this one. And then we have a kinetics, slow fast kinetics, by using the different anion like nitrate, carbonate, and phosphates, so that we can vary it. But importantly, say we generate the breast cancers here in the mice, and then we inject our systems and they heal the cancer or the tumors. And we have schematically shown it here. If it is pure drug, and if we inject into the cell, and this cell to this cell, and there are very few cells are getting died. And if you hide the drug within this nanoparticle and they are injecting the same cell, and they are actually killing lot more cells. So these systems is effective, much effective for killing the cancerous cell. On the other hand, if we put it into the mice, and then these mice actually loses weights very significantly, and its liver is getting damaged heavily. That's the reason why there is a loss of appetite, because just after the chemotherapy, usually the patients, the livers are getting damaged severely. That's what they don't able to digest or not able to take food. On the other hand, if we put this system, so where there is a controlled release, not so much of drug getting released in one go, very slowly it is released, and then it does not lose its weight, a very not insignificant weight loss, but importantly, there is no damage of the liver. This liver is like a normal liver. That's the important aspects of the nanoscience, where the slow release of drug actually helps improving the systems of targeted systems, along with a very low side effect. At the same time, it kills the cancer cells, as evident from here. And the reason is, when we are hiding it, now it's electrically neutral, it's not negatively charged like pure aloxifene is negatively charged. So this is slightly positively charged, which is get confirmed from the surface charge. And the surface charge actually slight positive here, which can actually sit over these cells and can go inside the cell and kill these cells. So this is these whole mechanisms of how the nanoscience works. And the same concept is applied to the polymer nanocomposite again. So we embed the drug, and then we covered it up with the polymers in the form of composite. And then we see that, okay, I mean, even the release is very, very slow. And that's very effective or good enough for the uh, cancer treatment or the tumor treatment. And it's whether this is going inside the cells or not, and then we have a corresponding image where the cells are basically accepting a lot of drugs from this system, as opposed to the pure drug. Pure drug cannot go because it's repelled by the cells. So that's the how the composites are very helpful in targeted drug delivery, systems which effectively kill the cancer cells without any side effect. That's the plus always. Uh, the without any side effect, it does not. The animal does not lose its weight, and its liver is, almost normal. So that does mean the patients undergo this treatment will not have loss of appetite or loss of hair or the nausea. Nausea is often felt by the chemotherapeutic patients because the along with the muscles, the drugs are going into the blood barrier, the brain blood barriers, say, which is going basically it is going to the brain, and then it's affecting the brain cells which cause nausea. So, and that part is effectively can be alleviated by using the composites polymers, and then through targeted and slow release system is called the sustained release, can help improving the property. This is the another concept is being applied to the gene delivery. So what we did, we hide the DNA inside these LDH, which is the layered double hydroxides, and then if we hide the DNA between the layers, and we can put inside the cells and so on, and we can see what is the effect of the DNA. Basically, gene repairing case we have applied onto the systems through cellular models. But the effective science is that we can hide the DNA in between the layers where they can be stored well, and they will not undergo any decompositions if they are uh, just injected in the blood only. So there will be DNA's enzyme which will chop up these DNA. But as it is within this one, within these gallery, so it is unaffected, and we have shown it through this experiment. And then DNA's cannot disturb this part, but DNA can hydrolyzed or can break the chains of the DNA and by the DNase, which is enzyme which destroy the DNA. So delivery is absolutely fine if we embed it with uh, the layered double hydroxides of the of particular dimensions. And here the dimensions of these LDH is around 70 to 100 nanometer. So it's basically a hexagonal shape, and its diameter is our average diameter is around 70 to 100 nanometer. Okay, this is the probably the last one slide, and here we use the traditional Indian medicines. They are these are the names, and in Hindi it's called Bhat, Asatha, and so on. Na- and they are very common and available in India, and this medicine is being used since Charok and Susrut. So this is a very traditional Indian medicines, but it has the problem of storing it or dispersing it into the in the in the in storing in the laboratory or in the hospitals, because once it is prepared the powder, so once it is dispersed in the solutions, it separates out. So it is not a very stable solution. So what we did, we improved the stability of these by using certain polymer. That is the first part. Second part is we used electrospinning to get the scaffolds, which are a kind of a cotton pad. So this is the cotton pad, and this is this film which is very hard. This is less used, sorry.
This is of less use, and but this is of very useful for patient treatment or animal care that we did. And this is basically a cotton pad, extremely flexible and extremely porous, so oxygen can permeate and pus can come out and so on. With this, we applied onto a mouse after creating a artificial wound. So these are the artificial wounds uh, in the mouse. And then we applied solution, film, and the scaffolds. And we have seen it here. Say before 11th day, the scaffolds heal completely. And in case of solutions, so up to 14 days, film and solutions, they show certain even the small the part of the wounds. So solution, the scaffolds are very effective, and because of these two reasons of porosity and the flexibility, it doesn't hurt the wounds once it is wrapped up the wounds with these scaffolds. And we have a very good hospital in the campus, and we collaborated with doctors, and he did a clinical trial for us with several patients, at least 30 patients. So these are the image of those patients treated, solution, film, and the scaffolds, and different wounds. I mean, there should not be any control in a clinical trial, and that shows very nicely. So the wound size is extremely large, more than 6 inches. So you cannot think of. I mean, there are a lot of underprivileged people who did not get any care during the wounds and so on. Whenever they come to the BHU hospitals, many of the patients are severely affected with very large wounds. So, but this is how we treat it. So I'm sorry, I am not authorized to treat it. Professor Sahu is my collaborator, and who is a anorectal specialist and a surgeon who applied this on the human being. We did the clinical trial for the animals only, and this is done entire. This work is done by Professor Sahu at the BHU hospital. So this is the size is, I told you, more than 6 inches. It's very the large size, and so that's what it took a little long time. But those patients were trying in other way, but it was not healed. But somehow these Ayurvedic drugs are very effective and heal these wounds. So we had several trials in different locations of the country. One in Sri Ravi Shankar's hospital, we had a clinical trial, and they had a very nice the clinical trial. One person is having two wounds in one hand, so one was treated purposefully and another was not treated, and then it was shown that which was treated and that is affected and that is healed in time. I'm not showing the image, and there are several images I have, and then it is not getting healed which is not treated. So that clearly demonstrate the efficacies of the patch and these things. So we have developed certain other things also which are under trials for different the different state of the materials, starting from solutions, gels, and the patch, solid phase, films, and so on, which are extremely useful of treating patients, including the human being. And we are also treating some of the animals, and in which we have a very large dairy, and it's hundreds of cattle there, and then we are treating them, some of them, and it is working extremely well. Okay, and then this is the solution, and how it is getting cured, and this morphology clearly tells that, okay, I mean, it is very effective for the wound care. Okay, so this is about the biomedical use. So I will talk about the applications of the material for energy uh, generations. We applied the PVDA, polyvinylidene fluoride composites, so where the few percentage of nanoparticle are embedded into this, and these are the conformational changes. So this is piezoelectric. So this piezoelectricity, we have applied a force or stress into the systems which generates this current, and these currents or the voltage, both the things we can measure up to under the application of the stress, as it is a piezoelectric material. And so this is only possible if it is a composite, because the in presence of the nanoparticle, polymer convert into the beta phase, which is all trans, and shows the piezoelectricity. Pure polymer, which is the Tg dot, the Tg prime, and which is not at all piezoelectric, and that's the reason why it shows the piezoelectricity in presence of this one. Okay. So an application is this. I mean, there are different types of material, and then voltage and other things are different. And the applications is, if we uh, okay, you can probably you can see it. Okay. I mean, if we apply the stress, and you can see the generation of the signals. So that is, I put it here, different modes of applications which generates the no, it's not working. Okay, so these are only working the different modes which generates voltage and this current, and in this there are biomedical applications of this is, so this is one of the scaffolds, and we use a different the peel of this anar and the orange to generate certain voltages also. So with this, I will stop these ones. So I mean, these are all composite materials, either the egg whites or these egg cells, or the peel of orange and the promegantry, and then they are showing a composite, a piezoelectric composite, which produce the energy. Okay, so my the conclusion of this talk is composite material for better life in terms of the biomedical and the energy sectors in mind. So with this, I will stop it here. And if you have any questions or queries, and then you can tell me. I'll be happy to.
Thank you very much, sir.
Huh?
Thank you very much for such an informative session, focusing all the recent areas related to the biomedical applications and giving the stress on the polymer nanocomposite, preparation of composites, fabrication of composites along with characterization, nanofillers and controlled biodegradation, nanoparticles bone regeneration, then effective cancer treatment, clinical studies, traditional Indian medicine, and energy harvesting system also. So we are very much owed to you, sir. And now, if the participants wants to interact with sir, they can interact.
Please, I will be happy to discuss.
If anyone has any question or anything to know from sir, then please raise your hand. So there is one question in the chat box from Mr. G. Kirubakaran. He had asked the question, how to understand SAM morphology.
Yes, the same basically tells the surface morphology, whether the surface is uneven and how much uneven it is. So it is basically talks about the surface roughness or the surface morphology. And they say in presence of the nanoparticle, sometimes do they change? Like I showed you, say nylon or PVDA, there is a completely change of morphology. And say spherulitic morphology to needle-like morphology, uh, which is basically induced by the nanoparticle in the polymer.
Thank you, sir. Sir, there is another question.
Please.
Is UHMWPE composite suitable for hip joint replacement or in any other medical field?
Yes, I mean, now actually the present scenario that ultra high molecular weight polyethylene is being used, and which is showing moderately high mechanical strength, and in this case is actually different, which are a highly cross-linked one, which is being used at present. But same thing can be done. We did not work on this, but these things can be done using the nanocomposite also. Say nanocomposite also improves the mechanical properties, like the cross-linked polymers, ultra high molecular weight polyethylene. So yes, I mean composite should help in this matter also.
Thank you very much, sir. Thank you very much for spending your valuable time and giving us such an informative session, sir. Thank you, sir. So after this session, we will have lunch break, and we are waiting for 5 minutes, and sir is having low bandwidth. So sir will resume again. Sir will join the session again. So we are waiting. The next session will start at 2:30 p.m. and the talk will be delivered by Dr. Nirmala Devi, and she will focus on the topic polyelectrolyte complexation, greener and safer approaches in designing micro and nanostructures. Sir, sir, am I audible to you, sir? Thank you very much, sir. So our next session will start at 2:30 p.m. and some study materials are uploaded in the Otol portal. You are requested to go through it. Some study materials are uploaded. Please go through that, and in the test, those will be the study material for the test purpose, which will be scheduled on 11 February. Please go through. Sir, am I audible to you, sir? Thank you very much, sir. Thank you, sir. So, dear participants, I am sharing Professor Polymer sir's communication email address. If anyone has any queries, you can interact with sir through email. So now it's the lunch break. So we will meet again at 2:30 p.m. And please check the Otol portal, important documents section for the study material. Thank you. Good afternoon, ma'am.
Am I audible?
Yes, yes. We'll start at 2:30.
Okay, fine.
A very warm good afternoon to dear Dr. Nirmala Devi Madam and the participants. Before going to start the session, I briefly want to introduce Dr. Nirmala Devi Madam. Dr. Nirmala Devi is at present Principal Dona International Institute of Assam, India. She has held previous positions as Assistant Professor Senior in Chemistry, Central Institute of Plastic Engineering and Technology, formerly. Now it is Central Institute of Petrochemicals Engineering and Technology, Jaipur, Rajasthan. Assistant Professor in Chemistry, National Institute of Technology, Nagaland. Adjunct Instructor of Chemistry, Huston Tillotson University, Austin, US. Senior Research Scientist, Pool Scientist CSIR at Indian Institute of Technology, Guwahati, Assam. And she is also the recipient of UGC Dr. D.S. Kothari Postdoctoral Fellow. And she has number of professional recognitions and awards, and among them, National Award for Technology Innovation by the Ministry of Chemicals and Fertilizers, Government of India, Young Scientist Award by the International Academy of Physical Sciences, and she is the recipient of prestigious Women Scientist Award from Department of Science and Technology, Government of India. She has number of international peer-reviewed publications and lots of professional membership, among them American Chemical Society membership, Asian Polymer Association's memberships are few of them. Today, Ma'am will deliver her lecture on the topic Polyelectrolyte Complexation, Greener and Safer Approaches in Designing Micro and Nanostructures. Thank you very much, ma'am. Thank you very much for joining us. Over to you, ma'am.
Thank you, Dr. Jyotika, for the nice introduction. Am I audible?
Yes, ma'am.
Thank you, Dr. Jyotika, for the nice introduction. I am directly going to the topic. So today the topic of my presentation is polyelectrolyte complexation, greener and safer approaches in designing micro and nanostructures. And we are doing in variety of fields, in the same field, in the variety of ways we are working. However, I will try to give some overview of our works that we are doing last 15 years. And let me start now. We have miles to go. So in the first slide, I'm showing you some of the spider webs. So may I know from which field participants are there? Mostly they are from chemistry, chemical engineering, I hope, mechanical engineering, or material science, or any other field?
Biotechnology,
okay.
mathematics, also.
Biotech, yes. Okay. And so people from biotechnology are also there. So I will try to give an overview and try to also try to also go to some extent to bio or that kind of field also. So keeping in view all of these, I have prepared some of the slides. So can you please tell me what is in the slide, in this slide?
What web will be weaved next? NASA does not have a design.
What web will be weaved next? Okay, so it is a spider web. So participants may be thinking of that Madam has shown us these dirty webs. Why in the first slide? So yes, we will start from this. They are the most beautiful creation of nature. That's why I have shown in the first slide this one, to raise some questions, to think, to throw some of the thoughts in chemistry as well as in material science. So that you can take some takeaway take some things from this class, take away to your home from this class, so that you can have some topic to think how the nature is making this kind of beautiful materials. So this spider, anyone who has like walked away or accidentally touched the spider web, maybe they have attested some of the properties of the spider webs. So among them, some common properties, we already know that they have very good strength and enough flexibility. It can stretch. It has enough flexibility as well as strength and as well as adhesiveness. These properties are required to the spider to catch their prey, or we can say their food. So why I have shown this these structures is that along with these properties, see, we know that these silks are made from protein, or we can say that they are a kind of biopolymers. So where from these spider webs get this protein every day? Because they weaves this web every day. Even we clean one day and next day we'll see that some small webs are there at our home. So this is that thing where they are getting all these proteins. They are continuously weaving it. So where? Do you have some idea where they are getting all these proteins every day? They prepare, yes, Dr. Geeta, they prepare it in their body. Yes, partially. Yes, it is partially correct. And thing is that they prepare it in their body, but thing is that they cannot prepare it directly. Thing is that whatever they can ingest this up to 2/3 of the material, they ingest itself. Like they can ingest this material every day and they recycles it. Again, from the old material, they mix the new material. So the same material they are recycling and they are getting, and up to 2/3 of the same material they are recycling. So this is there lies the like theory that recycling, the nature is doing the recycling by itself. And how beautiful the properties, you can see all the properties. That's why it is called that nature does not have a design problem that people have, but people do. So in the next slide, recycling in nature. So these all spider webs, you can see the significance in natural world. We can compare with Kevlar, the very beautiful material that humankind has created. Kevlar, which is very enough strength, good toughness, stiffness, all these properties are there, tensile strength. We can compare if we compare the properties with Kevlar and spider dragline silk, you can see that strength rating of 1.1 gigapascals, not as strong as Kevlar, as it has 3.6 gigapascal, but tougher than the Kevlar. But the spider silk is tougher than the Kevlar. You see here, the toughness is, the amount of toughness is higher than the Kevlar. So rigid spider silk has toughness factor of 180 megajoules per meter compared to Kevlar's toughness. So the factor of 50 megajoules per meter. So the toughness is very high. Even we compare with, for again, other properties are also there, like adhesiveness, strength, and all these properties are very good. Even it is better than the steel and other materials. So just for one introduction only, or for some interest only, I've said about the spider webs. Can we make these kind of materials? Can we make these kind of materials for as a future plastic material? So in the Science Advances, there's an article that's published as a production, use, and fate of all plastics ever made. So what is the fate of all plastics ever made? We can think of all this, since this course, this FDP is not about the waste plastics or like that. So I'm skipping it quickly. I will go to the drug delivery and preparing micro and nanoparticle structures. But quickly have a rough idea about plastics and polymer science. I was reading a book written by Susan Frankel. She was a noted scientist and science fiction writer. So you can see here the book, Plastic, a Toxic Love Story. So is it? The question always arises in my mind, is the plastic a toxic love story of the humankind? See, plastic is written in this way. This is chair. P is for chair. This L is for your comb. You can see here. A is for your lighter. And then These are polyethylene or bags, we can say. This is your IV bags and bottles. You can see here all the plastic is written in this way, very beautiful cover page. And she has raised the question. This was one of the New York Times bestseller book, and also awarded many times in different categories. So she has raised several number of questions from history. She started from history and raised several questions. Is it a toxic love story of humankind? So the history we know about celluloid to toxic love story. The history we know, ivory, it was started from ivory, that we know. Ivory, it like a billiard ball. For the production of billiard ball, once your munitions company declared award of $1,000 award prize for making a material which is as stronger as ivory. That time only ivory was there to make billiard balls. So there's no other option. It was only the option was from your natural world, from elephant. So they have declared, because the shortage of the ivory, as well as for some environmental concerns, they have declared that they will give $1,000 award prize if anyone can give or can invent a material which is as stronger as ivory. Then responding to this award, one guy that he was only 18 years old that time, invented John Wesley Hyatt. He has invented in 1868 for munitions company this material, the cellulose. He added nitric acid, and then he made nitrocellulose, which is commonly called gun cotton. Then with the nitrocellulose, he added camphor, and cellulose was made. We can call is first ever made polymer, or like man-made, but this was bio-based. Even it was a man-made, but this was bio-based because he used cellulose. So, but later it revolutionized the motion picture. That time, that time we know Edison was working on motion picture, and it was they were using some photographic glass plates, but the glass plates were very brittle. It can break, and very heavy also, we know, and they are very brittle. It can break at any moment. So it is very difficult working with glass plates. So this material revolutionized, because it has replaced the photographic film with this celluloid materials. That's why the called celluloid industry. So it has revolutionized the whole celluloid industry till date. And after that several versions were invented. That is the other thing, because later again in the celluloid, nitrocellulose is nitric acid. Later they have replaced this. They have also make some safety films. Acetate. So later the products were developed in different way, but the initial history was like this. Similarly, silac is a gum resin which is extracted from plants, but this silac is replaced by this is the material. That time used for as a insulating material mainly. It was replaced by bakelite. Am I audible?
Yes, ma'am. Audible.
Am I audible? And is the slide visible?
You are
okay, fine. Okay, then it was replaced by bakelite. In the same way, Leo Baekeland in his own. Okay, fine, that's fine. So Leo Baekeland, in his he has his own laboratory. That is your Zenel. Later he developed as a Zenel Bakelite company, but in his own laboratory, he has developed in 1909. He has developed bakelite. Bakelite we know about phenol formaldehyde resins. So later he developed. This is actually purely man-made synthetic plastics, first man-made synthetic plastic, we can say this. So later he has raised his own company, General Bakelite Company, and he has invented 400 patents out of this material only. About synthesis, about processing methods, about uses, he has made 400 patents. And he called this material as the material for 1,000 uses, because it has lots of uses. We cannot say in one area. Around 1,000 areas of use are there. So that's why he called it a material of 1,000 uses. So, and the logo of the company was given, the logo of the company was given as an infinity. In the mathematics, we use infinity symbol as a infinity, symbol. The same symbol he has given to his company. The logo as a logo of his company. To to clearly to clear the fact that the material, this material has 1,000 kinds of uses. So this has revolutionized the electrification that time. The main thing it has done that time was that it has revolutionized the electrification, because the same thing again, Edison was working on electricity, also Nikola Tesla was working, we know. So this time that they need a lots of electrification, they need insulating material. Only silicon cannot serve the purpose. So all this purpose was served by this material, bakelite, as a insulating material. It was that time, it was so popular that after 2 or 3 decades, it was so popular that in 1950 Time magazine, they have searched for some beautiful English words. So do you know what was the most beautiful English word in 1950? Like of that, from 1940 to 50, of these 10 years. Which was the most beautiful, which were the 3 most beautiful English words? One was mother, one was memory, and third one, do you know what was that? That was cellophane. Cellophane was one of the most beautiful English word of the last 10 of that decade, 1940 to 1950 of that decade. Cellophane, that was a polymer. So that's why we can say what is the like our popularity, that the popularity of the polymer, our love story with polymer grown in this way. But where we are moving, the question always arises, where we are moving. Are we moving in the right direction? So recent trends in India are towards biodegradable plastics, though we have lots of like recent trends are there towards biodegradable plastics, though all are not materialized, but there are some examples which are in fact materialized and are working. So single uses, there are lots of works on biodegradable plastics. The industry is gaining huge popularity and expected to be worth 6.12 billion by 2023. So green plastics, we know already about benefits of safer decomposition and energy efficiency. So plastic roads, we know about Plastic Man of India. So chemistry professor Rajagopalan Vasudevan was like in Chennai. He has developed the technology to build roads by plastics. So all about the roads made of plastic composites have better weathering resistance than the standard asphalt concrete roads. So these roads do not absorb water and have better flexibility in which in less rating and less need to repair. So this way, some few of the works are done and also materialized. So there are some success stories of Gujarat, also Gujarat and Jaipur. So co-processing of plastic. This is a very interesting technology. So using waste plastics materials as an alternate to fuel or raw materials in industrial processes such as cement plants is known as a co-processing. So what is this? The advantage about the technology is that it can substitute the use of coal and petroleum in industries like the cement plants. So how? So this was a collaborative work between Gujarat Pollution Control Board, your GPCB, and the recycled paper-based industries, because recycled paper-based industries, they have enormous plastic waste. So paper-based industries and cement industries in Gujarat so succeeded in having a scientific solution of utilization of this technology by designing in a new way. So how? The paper mills, they have like enormous plastic waste. So the paper mills because the paper mills have enormous plastic waste, they are recycle paper-based industries. So we know that like packaging or the paper mills which are using most of the like lots of papers or in our copies, in our books, lots of packaging material is there, no? So for water repelling, is to make them water repelling or to make them hydrophobic, we are using lots of plastic materials. So all these plastic materials from recycled paper-based industries, they are used by the cement industries for as a fuel. So cement plants started utilizing the plastic waste of paper industries. So it was a collaborative works of 3 things. First was cement industry, they were utilizing plastic as a fuel, and second of the paper-based industries, they produces recycled paper-based industries, they produces lots of papers, like waste papers, waste plastics, and these plastics were used for production of fuel in your cement industry. So this was the co-processing of plastic. The good news is that in 2012, Gujarat success story encouraged like neighboring Rajasthan to utilize the paper waste plastic based technology as a thermal substitute for cement kilns that promoted circular economy and overall reduction of pollution. So in this way, we can get some of the success stories. I have given only few examples, but it's possible. I want to say that just want to send the message that it's possible and it can be materialized. So we can say that the diversified use of plastics, they have become a part of our life today. We already know. In fact, they have become as essential to mankind as food and water these days. So this 1, 2, 3, 4, 5, and 6, mostly people knows these things. So one is for PET, polyethylene terephthalate. We know they are very clear. We can identify the plastics in this way. If you want to segregate, we can identify them in this way. These are called recycling numbers. This one is for polyethylene terephthalate plate, PET, clear, tough plastic, such as soft drinks or water bottles. Then HDPE, high density polyethylene. This is written as 2. So this kind of colored plastic jars. 3, hard, rigid, clear plastic. In this way, they are LDP, and the difference between LDP and HDPE is that LDP is your flexible plastic. They are used in squeezable bottles, and HDPE is similar, but the only difference is that it's slightly harder as for property. But for structurally, we can discuss them in different ways. So in this way, we can use different kind of plastics. So where do they go after use? So this is the main concern always. So landfill, incineration, and recycling. So these 3, they are going. But thing is that mostly we are filling the land. Here we can see the data. Mostly we are filling the land. These are the all concerns, as well as most important things I have shown as the orb spider web, as well as some good plastics, and also the concerns. Is it a toxic love story? So this overall idea or overall message I want to spread the first in the few slides. Now I am going directly to what we are doing, or what is the topic complex co-servation means to us. So in our laboratory, we are working on 4 different fields: encapsulation and delivery works, plant oil-based resins and surface coatings, wood polymer composite-based waste plastics, and polyparaffin diamine-based hybrid nanocomposites. In all the 4, we search for simple solutions to big issues, and we respect the principles of green chemistry. So in all the works, we try to add at least 1 or 2 principles of, or we try to follow at least 1 or 2 principles of green chemistry. So here we will go for controlled drug delivery. Many of you know, I think the basic things are very easy and clear. So the release of an active agent from the material in a pre-designed manner is called controlled drug delivery. So the release of the active agent may be constant over a long time, and it can be cyclic over a long period, or it can be triggered by any other environment or any other external events. And microencapsulation is one of the methods to prepare to encapsulate active agents. So microencapsulation is the process in which tiny particles or droplets or active agents are surrounded by a coating of polymer to give small capsules. So the small capsules means how small? They can be sometimes micron scale, sometimes sub-micron scales, or in the nanoscale range. So we are working in all the 3 areas: micron scale, sub-micron scale, and nanoscale. So I will show you one by one. So in case of normally in controlled delivery, what we have said, in traditional drug delivery, drugs or any kind of active agent, after every dosing, the drug level rises to the maximum effective level. Then it goes down to the minimum, like maximum desired level, then it goes down to the minimum effective level. So this is the maximum desired level, and this is your minimum effective level. So any drug or active agent or pesticide, so any drug or pesticide above the maximum desired level is no longer effective, they are toxic. And below the minimum effective level is they are no longer effective. Am I right? Any drug if it goes, the concentration is higher than our desired level, it is toxic. And if it goes down to the minimum effective level, there's a very low concentration, they are no longer effective. That is the main problems with the traditional drug dosing. But in case of classical control delivery, the classical methods, in matrix methods, what is done? The drug level remains controlled over a minimum desired level. This is maximum desired level, this is minimum effective level. So drug level remains constant over a long period of time. This is the thing. So it remains constant over a long period of time. These are the two basic methods. However, there are other kind of drug delivery which is called smart or intelligent delivery, where the delivery is responsive to pH, or it is responsive to temperature, light, magnetic field, or other external fields. So these are the particles. This is the current picture of the particles that we have prepared in our laboratory. This dried oil-loaded core cell microspheres. Later I'll explain. Then in water at 20 degrees Celsius, it swelled oil-loaded core cell microspheres. At 40 degrees Celsius, in water, they shrinks, and the olive oil was squeezing out, and the olive oil comes out of the core cell microspheres. In the next slides, these are the mechanisms. There are some control delivery mechanisms. These are the matrix systems. We can see here, initially the release is very high and slowly it decreases. And these are the reservoir systems where it remains constant over a long period of time. So that's why mostly these reservoir systems are preferred. So these are the particles. Neem seed oil, these are carrageenone, gelatin, polyelectrolyte complex particles we had prepared in our laboratory. I will go about the details of the particles later. So overall advantages, we can see that of these particulate systems, the overall advantages are the constant level of the active agent or controls the release of the core, reduction of the evaporative losses and flammability in case of liquids. If the active agent is liquid, then or it is very highly volatile, it reduces the evaporative losses. It can help in reducing the evaporative losses. Third one, reduce the reactivity of the core. If the core material is reactive, then it can reduce the reactivity of the core. Fourth one, promote the ease of handling. If the core material is liquid or sometimes is toxic or sometimes is very difficult to carry, then it can promote the ease of handling by making the core material solid, or the way we can carry it, the easy way we can make it solid, we can make it semi-solid. This is the things that it offers. And the masking of the taste and odor. If the active agent is very bitter or is not very good taste, then we can, I have seen also that some people are working on green tea and all are bitter things, which are very good, but they're very bitter. They were encapsulating this. People were, some people from Japan and China, I've seen that they were encapsulating the green tea and all these materials so that they can mask the taste. And sometimes some active agents are very good, but they have very bad odor. So that time also it can be encapsulated. So economic, and these are economical because the active material is needed very less. They are very efficient, so that's why they are economical. And other advantages, you can say the extension of the duration of the activity by protecting the active agent from bleaching and degradation, hence aiding your practical application. So dilute the core material when it is only used in small amounts. It can also dilute the core material, yet it comes out slowly. So the dilution automatically occurs. So since the toxic material becomes chemically non-toxic when attached with polymer, reduced mammalian toxicity results in case of pesticide or other active agent encapsulation. So these were the advantages. So what were the limits? Limits were cost of preparation and processing is comparatively higher than the traditional techniques. Use of excessive amounts of inert polymers. Third one is the fate of polymer matrix that I said already, fate, where they will go after use. So fate of polymer matrix and its effect on the environment. So all these three things, if we can take care, or if we can use biodegradable or natural polymers, then most of the things are reduced. So different techniques of encapsulation are chemical processes, which are suspension, dispersion, emulsion, polymerization, Polycondensation can also be used. There are physical processes like physicochemical or physico-mechanical. So conservation is physico-chemical process. There are also physical as well as some chemical processes involved. So conservation layer by layer technique is there. In the layer by layer technique, what is done? Positively and negatively charged polymers are added layer by layer, one by one. So you can give a number of layers. So how much controlling you want, in that way you can give number of layers like positive, negative, positive, negative. In this way, like 3-4 pairs you can give, and you can control according to your requirement. This is the layer by layer assembly. Is very beautiful technique and used in lots of techniques like applications these days. Sol gel encapsulation is there. Very easy and fruitful technique. Supercritical carbon dioxide assisted micro encapsulation is there, which is also very like environment friendly sometimes. And spray drying techniques are, these are physical techniques. So physical mechanical techniques are there, which are spray drying. There then multiple nozzle spraying, fluid bed coating, these kind of physical techniques are also there. So we will be focusing on this physico-chemical technique conservation in this presentation. So this you can see like 0D material, 1D, 2D, or these are polymer nanoparticles, liposomes, like micelles, hydrogels, dendrimers, and mesopoles. All these different kinds of nano carriers are used as control delivery vehicles for treatment of cancer and treatment of other diseases. But we can design them in different way. It depends on the drug, which kind of drug we are using, hydrophobic, hydrophilic, the functionality, lots of things, properties of the drugs, lots of things, as well as where or in which place it is utilized or where it will be targeted. It depends on all these things that all these things taken together, the decision is taken that in what way or in which way we will design the particles. So we have one publication in 2017. This is in Advances in Colloid and Interface Science on encapsulation of proteins and polysaccharides, because we specifically focused our work on proteins and polysaccharides, complex conservates. So there we can see that conservate. Now we are coming to the main topic, like conservate. What is the meaning of conservate? So origin of life and beyond. Some people say that this is the origin of life. We material scientists say that there is one of the method of making the particles, drug delivery particles, or it's a method of designing the particles. But biochemist, if you go in the point of biochemistry point of view, then people say that, scientists say that conservate is the origin of life. Historically, conservate is taken from the Latin word your acervas, which means he for aggregate. Aggregate of the particles is called your conservate, and then your like acervas. Then generally the term conservate signifies what is that? There is a metastable suspension of macro ion rich drops. So it is actually in reality the electrostatically driven dense liquid phase concentrated relatively on macro molecules. So more concentrated phase is the conservate phase, and the other phase, which is less concentrated, is your equilibrium solution. So scientist Tribex was the first to report the term conservation. Then there are two types of conservation now. One is simple and one is the complex conservation. In the simple conservation, as the name says, that is very simple. You can add some salt solution, you can add some charges, you can add some microions or some macroions, some non-solvent sometimes, and temperature, then change of pH. All these changes can give simple conservation. The thing is that we can change the pH, we can change the ratio sometimes, we can add some non-solvent, or the temperature change, or the charge, because charge matters. In the conservation works, always the main thing is that charge matters. So if we change this, then the simple conservation occurs. But it is done mainly in single polymers. So if we use two polymers or two macromolecular solution, and we allow them to make conservate solution, then or like two immiscible polymers which are oppositely charged, if we make them solution and then allow them to to happen complex co-servation, then if two macromolecular solutions are used, then it is called complex co-servation. So this was first done by your Bunzenberg, De Jong, and Pruitt. They have introduced the term complex co-servation in order to distinguish it from the simple co-servation of a single polymer. So the things are simple. For single polymer, it is simple co-servation. For complex co-servation, they are two or more polymers. So Bunzenberg, De Jong first investigated systematically the complex co-servation of gum arabic and gelatin. They are explored polymer pairs. In complex co-servation, mostly we use the polymer pairs. We have already discussed. So this gum arabic and gelatin is the mostly explored polymer pair till date, and utilizes lots of microparticle, nanoparticle, pressure-sensitive gums, adhesives, lots of things. It has uses. So Soviet biochemist, people are from biotechnology field here in our class. So Soviet biochemist, he was a Russian biochemist, Alexander Ivan Oparin. He cited his work, Bunzenberg, De Jong, and mentioned the similarity of protocells. He was a biochemist. Oparin was a biochemist, and Bunzenberg, De Jong was the chemistry professor that time. So this biochemist cited his work and mentioned the similarity of protocells, which are proteinoid microspheres. Protocells and coservate, suggesting that life first is generated in coservate droplets. So very popular theory is there in biochemistry, that is Oparin-Helden theory, believe that life developed from coservates, microscopic, spontaneously formed spherical aggregates of lipid molecules. So that's why origin of life, we can say that coservate was the origin of life. It started from coservate formation. So the first theoretical analysis was also done that time, and the theoretical analysis of complex coservation was given by Wood and Overbeek. Now, while citing about Oparin and Helden, as I have said, Oparin-Helden theory, here you can say that Oparin, this biochemist, has done a lot of works on origin of life. So the origin of life by A.I. Oparin, one book is there. It's a very good book of 1930, 1920 around. It was published in the origin of life on the earth. That he has lots of books, but these two books are very beautiful, and we can see the mention. We can see the mention of microspheres, these polymer particles, how they are related to origin of life. Yeah, this was simply just for understanding, simply to have an overview. Like Oparin-Helden theory was like this, like Helden soup. It is called Helden soup, and the simple molecules. They were simple molecules. Complex molecules are building blocks. Then aggregates were made. Coservates and microspheres were made. You can see this microsphere picture. Then after coservate, protocells were, like it is happening, they are your pro-primitive stage before formation of true cells. These are protocells. Then protocells plus nucleic acid, they are self-replicating system, and the whole cell chemistry was designed, like cell chemistry or cell bio, whatever you can say, a cell was designed by nature. So in nature also there is like lots of designing. So can we mimic them? This is the thing. Humankind can mimic the nature, or to what extent? If yes, then to what extent? So Helden or Oparin theory is not our subject of matter to today's class. Still, while citing Helden, there is always one funny things, or like his great quotes we can remember. People knows that J.B.S. Helden was a British scientist, but most of his life he lived in India. He thought that India is a country of free will, or free where people can speak. He thought like that for India, and most of the time he lived in India. He has also dual citizenship, Indian citizenship. So at the time of like now, my own suspicion is that the universe is not only queerer than what we suppose, but queerer than what we can suppose. What is it? The universe is not only queerer than what we can suppose, but also queerer than what we can suppose. If the universe is queerer than what we can suppose, then think. So how much queerer the universe is? First thing is this one. This quote always gives me to think about J.B.S. Halden. When his name is cited, I always remember this quote. Second is the cancer's funny thing. When he was in Bhubaneswar, he was in Statistical Institute of Bhubaneswar for a long time. He also, J.B.S. Halden, he also said several times that mathematics should be included in bio courses. I think mostly people know in India that time, still today also, mathematics subject is not included in bio courses. So he was the person who supported or who said that time that mathematics should be included in the bio or all bio courses. So this was the J.B.S. Halden. He also worked in Indian Statistical Institute that time in Bhubaneswar, and at the time of his death, again he wrote one poem. It was a long poem of 2 pages, but I have only quoted 4 lines here just to refresh. Cancer's funny thing. Time of his death in 1964, finally he had cancer. So that time before his death, about 2-3 days, he wrote this poem and sent it for publication. It was published in New Statesman that time, and again it was reprinted in International Journal of Epidemiology in 2016. I have just given 4 lines. How beautiful are they? The lines you see. I know that cancer often kills, but so do cars and sleeping pills. Are not they funny or good? Good enough, no? I know that cancer often kills, but so do cars and sleeping pills. And it can hurt one till one sweats, so can bad teeth and unpaid debts. Spot of laughter, I'm sure, often accelerates one's cure. So let us, patients, do our bit to help the surgeons make us fit. These 2 lines I like the most. I know that cancer often kills, but so do cars and sleeping pills. This was J.B.S. Halden. And he did the mathematical part of the theory of Halden-Oparin theory, you see. And they both did independently. This Oparin and Halden, they both did in an independent work, and they mentioned one another. That was the thing. So about conservates. So these all are history. So simple conservation, I already said that encapsulating polymer dissolved in a solvent. This is the simple conservation. I said that addition of non-solvent. We can add some non-solvent and then encapsulate the core material. Second one is that complex conservation. So preparation of 2 solutions of oppositely charged electrolytes, dispersion of the active agent in one solution, and then addition of one electrolyte solution to other containing the active agent. So if this is your, first we have to put the 2 solutions, then add the in one of the solution, add the active agent to be encapsulated, then add the other polymer solution. Then we can, in this way, we can do the complexation and precipitation. But the thing is that there's always some art in making the particles. When you add a positively charged polymer and a negatively charged polymer, they will aggregate or they will precipitate or they will combine. That we know. But the thing is that how we can make them, how we can give them a particular shape that we need, or how we can design them in a particular size or shape. There lies the main art of these conservate particles. So protein encapsulation using complex conservate, what nature has to teach us. Written by, this is a recent article written by Sarah L. Perry. I met her in Boston conference in SCS 2015. It was in Boston. So I met Sarah Perry and her group. These people they are in University of Massachusetts. So they are doing lots of works on these complex conservates. So we can design in number of ways, complex conservates, micelles, emulsions, your water and oil emulsion, oil in water emulsion, also water oil, water emulsion. So these proteins, the core material or the main material, protein can be designed in different ways. So all these ways have again inside lots of things we have to know. Those things looks very simple initially, but for a person has to devote whole life for one thing only. Still, always new things are arising in this field. So she has written, Sarah Perry and her team has written lots of good articles in complex conservation. Here we can see like no salt. You can see here 100 millimolar of sodium chloride, no salt, pH 8.5, pH 6.5. By changing all these things, the whole chemistry of the complex co-solvent phase changes. So there are also some good works on proteins or neutral blocks and making the complex conservation by changing basically the three things: pH, then ionic strength, and then polymer ratio. So I already said they were working in University of Massachusetts. So they are working lots of things on bulk conservates, on complex core conservate corona micellis, conservate core micellis, and new things are appearing every day. So about designing the particles. In our work, we did simple polysaccharide and proteins, and we got this kind of very beautiful free-flowing particles. So then we cross-link them. Initially the protein. So every like protein will have NH2 group. We know some COH group, acid group, and amine group, NH2 group. So here only NH2 is written. So NH2, and then this is your glutarialdehyde or any kind of aldehyde we can add for cross-linking, or we can also add some of the natural cross-linkers are there available. So we can also add some natural cross-linkers, and we can allow the polymers to cross-link, or we can allow the particles, because once the particle is formed, once we can design or we can make the particles, but once the particle is formed, it needs to be hardened. For hardening, cross-linking is done by using different kind of cross-linkers. So basic components we were using were polymers. There are some synthetic active agents and cross-linking agents. There can be also there are several options in modified natural polymers, or some naturals and some modified, and also some synthetic polymers are there for several options of choosing the polymers. And the polyions are among them are like sodium alginate, pectin, carboxymethyl cellulose, kappa carrageenone is there, your xanthan gum, then sodium salt of your hyaluronic acid, gum acacia, heparin, carboxymethyl guar gum, chitosan. Lots of polyion options are there, and the drugs are also there. Like we can make coating for implant, or we can make microspheres, we can make beads, or microcapsules, nanocapsules, custard-like formulation, sometimes dendrimer-like formulation, nanofibers, scaffolds for tissue engineering. So different kinds of we can use in a different way. So the cross-linker options are also there. So lots of cross-linker options are there for gelatin. So among them, glutaraldehyde, diisocyanate, carbonamide, your polyepoxy compounds, formaldehyde, caffeic acid, xanepin, tannic acid, calcium chloride. Lots of options are there. Among them, we have used these three. Formaldehyde we have used, glutaraldehyde we have used, and xanepin. Xanepin is a natural cross-linker. So as a natural cross-linker, we have used xanepin. Tannic acid is also a natural cross-linker. So xanepin and tannic acid we have used, as well as we have used this glutaraldehyde. This gives a very beautiful cross-linking, glutaraldehyde. Very beautiful cross-linking. But this is a chemical cross-linker, and that's why we have used these two as a natural cross-linker. Among them, in our work for protein cross-linking, xanepin was very good. Xanepin was one of the best cross-linker. So effect of cross-linking agents on neem, seed, encapsulated microspheres of carrageenone and cytogen. We worked on the effect, and we found that this is a cross-linking mechanism. I will not go in the detail. Thing is that this amine part, this plus and minus, when they combine, and it forms polyelectrolyte complex, and the cross-linking mechanism I have already shown. This amine group is formed, and this if we compare the glutaraldehyde and xanepin, I have already said, like xanepin works very good for proteins, and it is a natural cross-linker also. Xanepin is so good that if we like initially when I started working with xanepin, so if it some drop or some part of the fraction of the drop is fall on your fingertips, then it will become blue. It gives blue color with your with the proteins. When it like in the two-way, the reaction can be monitored. So when the color of the particles becomes blue, or the color of the products, if you cannot see the particles because they're very small, you can see the product. If the product color is getting bluish and then slowly blue, then you can share that they are cross-linked. One is that one. And if a very slight portion of is stick to your the solution, like 0.05 millim, like 0.05 molar you prepare, or 0.005 molar you prepare of genevieve solution, and if one drop falls on your finger, it will become blue. It's like that. So your finger will, after 1 or 2 hours, it will take like a blue color. It will get blue color. So that is the strength of genevieve. It's a very good cross-linker. So active agents, among the active agents, we have used neem seed oil, basically because it is a potent biopesticide. So it can be applied to the pesticide field as a solid formulation. And so though it is a very potent biopesticide, the application of like neem seed oil to the soil is limited because it has a liquid nature. And so it cannot work in fields where water is usually utilized for irrigation purpose. So natural, second thing is that the natural does not mean 100% safe for all, because the neem seed oil is still toxic to fishes, tilapias, carps. It is still toxic. So all natural does not mean they are 100% safe for edibility purpose. So solution is that we can microencapsulate them, or we can give them a solid form, or can give them controlled delivery form to minimize the toxicity and to maximize the efficiency of the oils for longer periods. So this was used. And second was the isoniazid, which is a potent anti-tubercular drug. So we have also used other potential active agents, olive oil, vitamin C we have used, then the curcumin, and some metal nanoparticles, as well as some carbon dots. So carbon dots we have synthesized from sugar, and then bread, and all some of the carbohydrate materials. Then we also synthesized some carbon dots. We will not go here in detail about the carbon dots and all. So that is a separate chapter. So here in this lecture, we'll go for complex co-conservation to encapsulate neem seed oil and isoniazid mostly. So isoniazid this is your first line anti-tubercular drug, and it is used for treatment of TB along with your rifampicin sometimes, and your pyrazinamide and thambutol. So, and it is FDA approved medication. Thing is that it has toxic side effects. So duration of the treatment is longer, 6 months or more. And the Mycobacterium tuberculosis has the ability to persist intracellularly in the host macrophage. So Mycobacterium tuberculosis can persist in dormant state too. So thus giving rise to a large group of infected individuals who can carry the organism in a subclinical state, so without having active disease. Now the solution is that we can like optimum therapy is involves your intracellular delivery of antimicrobacterial agents for prolonged periods. So by encapsulating them, we can make them less toxic, as well as the release of the drug can be controlled to lower concentration, but in a constant rate. So the procedure here specifically, we are going for the complex co-conservation procedure, not exactly about the drug or pesticides, but how to encapsulate them. And that is called the polyelectrolyte complexation or polyelectrolyte complex co-conservation. So the methods we have used are two methods for the liquid oils, neem seed oil or olive oil. In both cases, we have used this one. If your active ingredient is oil or hydrophobic, then this method is done. Gelatin solution, say we have used gelatin, we can use or other other polymer also. So gelatin solution, then added neem seed oil, then your stirring was done by mechanical stirrer. Then what happens? The dispersion becomes once the dispersion is formed, increase the temperature to 60 or 62 degrees Celsius. Then the other polymer we have given here, sodium carboxymethyl cellulose. Then the other polymer, add the other polymer, sodium carboxymethyl cellulose is drop-wise added. Then when you add the solution, other polymer from the other side by drop-wise addition of the other polymer, one polymer is there in your glass beaker, other polymer is added from the upside, drop-wise, very fine drops. You can also use like a burettes or it can be like your medical syringe can also be used. And sometimes because syringe is very slow, so that's why sometimes like multi-nozzle, you can design the syringe in a multi-nozzle syringe, then you can add from the upper side. Then once they are mixed, if you add dropwise at 60 degrees Celsius, you will see that phase separation occurs. If you closely monitor the solution, you will see that phase separation occurs. So once the phase separation occurs and the phase separation is complete, reduce the temperature to 5 to 10 degrees Celsius. So the temperature is reduced to 5 degrees Celsius by adding ice to your bath. Then once the temperature is down, then glutarialdehyde, or you can add other crosslinker to, as I said, genipin. So you can add the glutarialdehyde or genipin. Glutarialdehyde, or in place of this genipin or tannic acid, crosslinker is added when the temperature is 5 degrees Celsius. Then again, have to increase the temperature slowly. This time temperature rate, like increase of temperature should be monitored, and slowly temperature should be increased because the particles are very soft this time. Though the particles are formed, they are very soft. So we have to capture them in that stage so that they will not break or they will not deform. So slowly increase the temperature. The crosslinker will work slowly, and within 3 to 4 hours at 45 degrees Celsius, the microparticles are formed, which are filtered, washed, and then dried. So in the similar way, if it is also done by water in oil or your oil in water way. We have used in that case sunflower oil as the base. So in the sunflower oil as the medium. In this method, in the next method, we have used sunflower oil as the medium, and in the sunflower oil, gelatin solution was added. Sunflower oil only acts as a medium; it's not as a reacting agent. Then gelatin solution was added to it. Then we continue stirring. Dispersion is made. Again, say in the same way at 60 degrees Celsius, your sodium carboxymethyl cellulose solution can be added, or also added sodium alginate, any kind of other polymers you can add, dropwise add, then phase separation occurs. In the similar way, lower the temperature to 5 degrees Celsius, then add crosslinker, microcapsules are formed. At this stage, stir it or keep it at 45 degrees Celsius and continue stirring for 3 to 4 hours. They are cross-linked fully. Then they are filtered, washed, and dried. They are very good microparticles which can swell like hydrogel. So you can do the isoniatic acid absorption later too. So, but the things are, this is the method that I have explained. In the both way it can be done. As a sunflower oil is a medium, or any kind of degradable or any kind of bio oil as a medium, edible bio oil as a medium, or can be done directly. Both way the controlling of or the size varies. So, but before that, I have said it a very simple way. They one polymer and then you will add the other polymer. Thing is that how the pH can be controlled. These things matters. Otherwise, if we add both of them, they will form some lump or aggregates. So to control, before that, we have to do some optimization works. So if you are using the gelatin carrageenan pair for the polyelectrolyte complexation, so gelatin A carrageenan system. So if you are using these two pairs, then again we have to optimize for how much or what is the concentration we have to use for the optimization. So effect of variation of gelatin concentration in gelatin carrageenan mixture was carried out. So this experiment was carried out, and the turbidity by how? By monitoring the turbidity. You mix them, this here you can see, by monitoring the turbidity of the mixture, by monitoring the relative viscosity of the supernatant, and by conserved yield. Three things are there. We can fix them. The ratio, what is the ratio? We can fix the ratio of the gelatin carrageenan system. And for fixing the ratio, first the UV studies or turbidity studies were done by UV visible spectroscopy. And you can see that with increasing the volume of gelatin, here in the ml, your absorbance was increasing and then your decreasing. This is the highest absorbance. Now, this is your relative viscosity. See, it will be clear when you see when your polyelectrolyte complexation is maximum, then your turbidity will be maximum. Am I right? So your turbidity will be maximum because there will be maximum polymer concentration in the mixture. So when the complexation is maximum, then the turbidity will be maximum of the solution. If you go for the supernatant, this is for the mixture. If you go for the supernatant, now you keep the mixture, then allow it to settle down, then like separate the supernatant. Now, if your complexation is maximum, your supernatant will have minimum polymer. Am I right? One is your supernatant, you will separate the supernatant. So your supernatant will have minimum polymer concentration. That means you will get minimum absorbance and you will get minimum relative viscosity. Practically, it's water only. So we are preparing one solution of polymer solution, a water solution of gelatin, one keraginin solution. If you mix them slowly in some ratio, so practically at the point of maximum complexation, your supernatant will have no polymer. It will all go to the, mostly will go to the complex. So this is the minimum point of minimum relative viscosity, and that point was noted down, and that was 66% for this gelatin carrageenan system. For all the polymer pairs, this is different, and that have to be experimented first. Then only in that ratio and in that pH we can carry out the microencapsulation process. The third one is the cosorbate yields that I have said. We have separated supernatant and the cosorbate. Then the cosorbate yield will be highest at the maximum point. So these points were noted down. If you see the effect of variation, again, see your cosorbate yield depends on ratio of the polymers as well as the pH. The one part ratio of the polymers is done, 66% was taken out, and then confirmed. Then again variation of pH. In that ratio, you see the variation of pH and check at which pH the your cosorbation is maximum. So pH here you can see 3.5. Again for yield, your pH was 3.5. So after this, you can see appearance of turbidity and complexation. You can see here immediately after adding what happens at ratio 1:3.5, because the ratio was 1:3.5, we have calculated already, and pH 3.7 exactly. So reaching the ratio and stopping of stirring. So you see, once you reach the ratio, here we have the ratio, but thing is that it's immediately it becomes like that. One immediately, this one after 2 minutes, it aggregates like this way. After 5 minutes, this is your after 2 minutes, here you can see, and after 5 minutes, this is clear supernatant, you can see, and this is your agglomeration. So at low stirring speed and high polymer concentration, the complex agglomerates precipitates in all the cases B. If you give very low stirring speed and very high polymer concentration, if you give very low stirring speeds, again, other thing is there. I have said one ratio of the polymers. I have said one pH of the polymers. Other thing is that your stirring speed. If you give the very low stirring speed and high polymer concentration, because someone may think that if you give the high polymer concentration, then yield will be higher. No. In that case, again, the things will be different. If you give very high polymer concentration, it will agglomerate. Very low stirring, it will agglomerate. If you give very low polymer concentration, yield will be very low. And again, if you give very low polymer concentration, the yield as well as the particle formation will be, again, we have to control in different ways. Size will vary, lots of things. Or encapsulation, coating, there is some coating material in some specific amount is required. Or the thickness of your core, if it is a core cell form, the thickness of the coating may vary. It may be very less. So all these things have to be taken care. Otherwise, it will agglomerate in this way. So our aim is to keep in this way, because this is exactly your supernatant, your complex conservation phase, as well as like the art lies. Where is the art? So art lies in arresting the precipitation. Once it precipitates, so arresting the precipitation when they are still in your desirable size range. When you are mixing immediately, when they are still in your desirable size range, if you are sure that I am making this size from 100 to 200, like your from 100 to 200 nanometer, or maybe some your less than 100 nanometer, or maybe your sub micrometer range from 100 to 400 nanometer, or in your micro range, then if you're sure that I am making this one, then the art, everywhere the art lies in the arresting of the precipitation when they are still in the desirable size range. Because at that time you have to arrest, at that time you have to cross-link them, or you have to harden them by other ways. So this is the thing. And that I have shown you earlier the method of making the neem seed oil encapsulated polymers. Here you can see neat carrageenan gelatin complex. This is your neat carrageenan gelatin. When you add carrageenan and gelatin, you will be getting this kind of complex. When you load your polymer 1.5 gram, here you can see neem seed oil 2 gram, you will see this kind of very spherical particles that are prepared from this carrageenan, gelatin, and neem seed oil. See, very beautiful particles we cannot see by our own eye. And when I see first the particles, I was surprised at how uniform they are. That like how uniform, as well as some like spherical particles you see. And when you use very excess amount of oil, like here oil is used 4 gram, you see it cannot, the polymers cannot encapsulate all the oils, and the oil will encapsulate, the oil will stick to the outside of the particles. So the amount of oil should also be monitored. Amount of oil or amount of drug or amount of active agent, whatever the active agent we are using, that should be monitored. First thing. Second thing is that, again, number D is your polymer is very high amount use. So if the high amount of polymer used, though the oil is encapsulated, you see there is no uniformity. Some big and some small are there. That means we are not controlling the particles. That means the stirring speed or whatever we are doing, that cannot control the particles, and they are not homogeneous. So some are big and some are very small. These particles are very homogeneous. These two types of particles are very homogeneous. In this way, they can be tuned by changing the ratio of the polymers, by changing the ratio of the changing the pH of the solution. So we have also, in the same way, we have also done, that was a gelatin carrageenan mixture. Then again, the next part is done for the another pair, gelatin alginate microparticles. So we wanted to see the particles how by our naked eye. So that time we prepared by some very high amount of polymer, and we swelled them because their swelling was very high. It swells around more than its own weight, so around 1200% or like that. And that time we can see when these are the swell particles, we can see by our naked eye also. These are the pictures we have taken. They are glutyraldehyde cross-linked particles. That's why they are yellow color. Glutyraldehyde, when cross-links with this gelatin, it gives yellow color. When genipin is given for as a cross-linker, these are all bluish colored or blue colored microparticles. So the same way optimization was done. In the same way, your optimization of gelatin sodium alginate system was done. And here you can see the first optimization done, then only the encapsulation was carried out. Here you can see gelatin percent is 77.77% in the mixture, and relative viscosity is minimum. At this percentage of gelatin, 77.77%, the relative viscosity of what? Of the supernatant. Relative viscosity we always calculate for the supernatant, because it will show the the minimum relative viscosity. That means it's practically the water or practically the medium only. So at this point it is 77.77%. This is the point. Is the minimum relative viscosity. So this is the point of minimum relative viscosity. It was noted down. It was 77.7%. If you go for turbidity, that will be maximum. Turbidity here is the turbidity of the mixture. So this is the maximum point. Then again the absorbance is your turbidity of the supernatant solution. Then again your absorbance. Here you can see this is the minimum point. Absorbance minimum. Here is the absorbance minimum at 77.7%. Here you can see percentage of gelatin, again yield is maximum. So in this way, the same way the study was carried out for pH, the effect of variation of pH, relative viscosity of the supernatant, turbidity of the supernatant, and percent yield. In the same way, pH was fixed. pH was 3.7 for this sodium alginate gelatin mixture. And at this pH and at this ratio, the encapsulation was carried out. First, it was carried out, I have shown two methods, one by direct etching, other by sunflower oil as a medium. So the first one I have showed the particles were by direct, and these are the particles that were carried out in sunflower oil as a medium. These are the particles which were synthesized by using sunflower oil as a medium. Okay, so you can see here without xenopin, that means without crosslinker, though the particles are formed, you can tell me that you can ask me that all are complex co-solvents, why they are not spherical? That should be spherical by rule, but thing is that even though the formation of the particles are spherical, thing is that if we cannot control, because they are very soft when they are forming at 60 or 65 degrees Celsius, they are very soft. They can easily aggregate. They can easily stick together and form lump. So the particles, if we cross-link at that stage, then only we will get harder spherical particles. So if we prepare the particles in the same way, same polymer ratio, same pH ratio, same pH like 3.7, the polymer ratio 1:3.7. But the thing is that if we don't add the cross-linker, it forms lump like this. If we are adding the crosslinker, slowly we are adding very less amount of crosslinker than even in the first case we have used 2-in-80 because we were making these particles in sunflower oil as a medium. So we have also used some to like minimize the size or to control the size. We have also used 2-in-80 or some surfactant to stabilize the particles. So 2-in-80 was used here, and total polymer was 1.35 grams. Xenopin was 0.05 millimole, very less amount concentration, and the particles are comparatively less aggregation was there. When we increase the your xenopin amount 0.1 millimole, the particles are forming. We can see here they're very good particles, and we can see here very big particles where we are using like your 280.518 gram of polymer, total polymer 1.35, xenopin 0.25 millimole. So we can see the other particles here, and they are very good, free flowing, and mostly uniform particles are there. The publication was published in Journal of Food Engineering, one of the very good rated journal in food engineering. And here also we worked for some porosity, because we have seen some porosity in some of the particles, some of the big particles under the microscope or scanning electron microscope. You can see there, if we study the porosity, these particles with very less 2-in-80, here you can see that effect of variation of 2-in-80, the surfactant, we are increasing the amount of surfactant from 0.037, 0.74, 0.148, 0.22, 0.370, and 0.74. So increasing the amount of 2-in-80, you can see here that the particles are becoming smoother. Particles are becoming, the surface of the particle is smooth, as well as they are forming uniform particles, as well as we can see here that the porosity of the particles is increased. So you can see here the porosity of the particle is also increased. Now, if we see the effect of variation of polymer concentration, again we varied the polymer concentration here. So why not to vary the polymer concentration? You see here 2-in-80 0.4, we have kept 2-in-80 constant here. Here slightly decreased 0.22 gram, then again increased to 0.44 gram. Here we can see the, with decreasing the polymer concentration, the size of the particles decreases. Okay, if we, another third work was done, like if we the polymer here, total polymer, the last one F, ABCDEF, here we can see the total polymer was 0.084, very less. Total polymer was 1.35, we are getting very good particles. Total polymer was here 0.675, these are the particles. Total polymer was 0.337, these are the particles. Finally, the total polymer was 0.084. If we take very less amount of polymer, we can see that particles practically will not form. They will try, they have the tendency to break down. The particles have the tendency to break down because they are porous particles. You can see here the pores. these porous particles, if the polymer is not sufficient, then they have the tendency to break down. So again, we have studied for drying, because once we cross-link, I've said that one of the most important art in making these particles is the cross-linking, or keeping the particles when they are still in the desirable size range. Second one is that once we cross-link them, we have to dry them. This is drying is also an art. We cannot dry them by heat or like that. So we have to, most of the time we dry them by vacuum dry or like that, because at high heat again the particles will be deformed. So thing is that we can see here the effect of drying, like these are the freeze dried particles in the bigger picture, and then like high resolution under low vacuum, these are the particles under low vacuum, and these are particles under high vacuum. C and D are the particles under high vacuum. So you can see that this under high vacuum, the particles are, all the particles are broken in this way. You can see this is a fixed particle, but most of the particles were broken. So in that way, like we have not applied the high vacuum, because at high vacuum, since the particles are porous, they have less strength than the earlier particles, and they have the tendency to break at high, if we dry them at high vacuum. So after making all this like studies, we have also done some pH study at pH 7.4, pH 6.6, pH 1.2, because the pH of our stomach is very less, it's 1.2, and then again pH of our intestine is almost like more than neutral, it is 7.4. So to mimic the environment of the intestine and the stomach, the pH was taken pH 7.4 and then pH 1.2 to study in the outer environment, and how the particles will release the active agents that was encapsulated. So we have seen that the release was high at pH 7.4, and the release was high, you can see here pH 7.4, and the release was low at pH 1.2. So the cross-linker, if we use very high amount, not only the designing the particles, again how the release is controlled. We know that cross-linkers will harden the particles, they will cross-link the polymer, and the release rate is decreased. So if we use the higher amount of cross-linker, though the particles are very hard, but they will control sufficiently, and you see cross-linker 2.5 millimole, the release rate was decreased. So having said that, like the cross-linker amount, though we can design the particles, again we have to take care of how much cross-linker we have to add, because that will depend on how much concentration or how much release rate we require for the particular drug or for the particular pesticide. So these are the optical microscopy images showing the swelling of microparticles in different pH. You can see here very beautiful particles. Here you can see optical microscopy images, the pH 1.2, then your swelling time 6 hour, they're 10 hour. You can see the particles, they are swelling. So this is the swelling studies, and TGA thermograms shows the good thermal stability of the particles. The same way that I've explained, so I'll not repeat it again, but in the same way that for your another system like gelatin SCMC, one was gelatin carrageenan, first system was gelatin carrageenan, second system was gelatin alginate, third system was gelatin sodium carboxy methyl cellulose. This also we have optimized. Here the SCMC percentage was 30% in the mixture to get the maximum yield. And at this percentage, there was very low, low supernatant relative viscosity. So this was optimized, and in the same way, the particles were prepared. You can see the very good particles and the variation of 280 and the formation of standardized particles. So in the same way, water uptake and release studies and pH studies were done, and also there were some submicron scale particles. They are not perfectly nanocapsules, though it is said nanocapsules at the time, but they are submicron scale particles. And the thing is that this TM was done very early. It was back before 12 years this work was done. So that time in this university and even in IIT Guwahati has not had a good TM. So this TM was done in Northeastern Hill University, where there is an old machine, and the time it was not computerized. They have to take some photographs. They give us some like negatives. No, we have to develop it. It was like that. We have to develop this photograph, then scan it. So these photographs were taken in the low resolution TEM that time. And the thing is that we have from these capsules, like from these capsules, we have taken out the oil inside was taken out by dissolving in some solvent, suitable solvent, and then the particles were made hollow inside. Then the drug was encapsulated it again. These were this kind of particles. So they are all about gelatin and sodium carboxymethyl, sodium alginate, and sodium carboxymethyl cellulose. Those three systems I have explained. So about complex conservation or polyelectrolyte complex conservation. All the polymers are, one is positively charged and one is negatively charged, chosen in that way. We can also choose other kind of polymers, keeping one positive and one negative. So we can design them in a numerous way. I will show you again how we have designed in numerous way. These are all spherical. I will show you also other particles. So now next is the why not to make them, since they were all pH responsive, we were tried to making them some thermoresponsive particles. So to making the thermoresponsive particles, our students that time were Devajit Hazarika was working with me as a student. So he worked on some of the works, and then what we did there, the methyl methacrylate as a core. We have used two polymers here. One was N-isopropyl, NIPM is N-isopropyl polyacrylamide, and then methyl methacrylate, MMA. So this is APS, ammonium persulfate, initiator. Then at 70 degrees Celsius, it was reacted for 24 hours. After 24 hours, again, N-isopropyl acrylamide was given. At 70 degrees Celsius, another set of 24 hours. 2-day reaction it was, and I was still sometimes at night in the lab that time. Back in 2010 to 13, that work was done, and it was a 24 hours reaction. So because most of the time you have to wait in the lab, because most of the time the thing is that normally the reaction is controlled, but your water bath is your, it dries, so you have to continuously add water after 2-3 hours. So you have to monitor the reaction at night also. So this was a long reaction, long time. It took a long time, but the particles were very good. So you see such a uniform particle. This was actually core. So this was a core, and the NIPM was the cell. The first part was the core was NIPM MMA, N-isopropyl acrylamide and methyl methacrylate. This was the core. This is also spherical. Then again, once the core is made, you add the N-isopropyl acrylamide from outside, then you will get the core cell particles. So ammonium persulfate was used as an initiator. In the second step, these are the blank particles without active agent. Olive oil was used as active agent because olive oil is used for many of the drugs. Many of the like drugs and medicines, olive oil is used as a solvent or the medium, the solvent for dissolving the drugs. Olive oil, which are hydrophobic, olive oil is used as medium. So it was encapsulated, and then APS, you can see the olive oil was encapsulated. They are thermoresponsive particles. This was the reaction, methyl methacrylate, this N-isopropyl acrylamide particles, and then cell was formed. So here also again the optimization comes. The reaction will become, the reaction will occur, but thing is that how do you control the particle size? So for controlling the particle size, there are two steps here. One is core, and then again shell was made. So for core, there are done in three things where three things were monitored by a continuous study in SCM, and then dynamic light scattering, DLS, or particle size distribution. So here, for the core, different polymerization times like 4 hour, 6.5 hour, 12 hour, and 24 hour. In the 4 sets, 4 hour, 6.5 hour, 12 hour, and 24 hour, the reactions were carried out. We can see that 6.5, 12 hour is also very good, but the 24 hour gives very beautiful, uniform. You see, all are very uniform. And not only by the SEM studies, and they are sub-micrometer. This is a 1 micrometer scale. They are sub-micrometer sizes. They are only around 200 nanometer particles. You can see here, these are the particles formed, and this is solid line is for this 24-hour. Number 4, solid line is for 24 hours. If you carry out the reaction for 24 hours, then they becomes very uniform. The particles becomes very uniform and homogeneous. So in the next step, since this is optimized for the core 24 hours, next step again, optimization of the initiator now, the APS, ammonium persulfate, because initiator concentration does also lots of things. So here also optimization of initiator and magnified view of the microspheres, you can see. Here you see that initiator was optimized by, again in the same way, by studying the dynamic light scattering or the size distribution curves of the microspheres and by SEM studies. So after then, 3 things were done. One is for time, optimization for time, optimization for initiator, and then optimization for your monomer phase ratio. There are 2 polymers are there, so monomer phase ratio is also need to be optimized. So monomer phase ratio was taken 2.5%, 3.5%, 5%, 7.5%, and 10%. So finally, all were optimized, and the optimized parameters we got were for core time is 24 hours and 0.4 gram of ammonium persulfate, 2.5% of phase ratio. In this optimized conditions, the addition of the cell material was carried out. You can see here how good they are, the free flowing particles and how good the particles are. Then the cell loading was done, like N-isopropyl acrylamide doses in cell fabrication was again for number 1 this is 0, and for 1 this is your 0.5 gram, for this is your 2 gram, and then your 3.5 gram, and then 5 gram. So continuously increasing. Then we can see now here the change of still they are very uniform because the core was uniform. These parameters was uniform. Uniform. The core is uniform. We can add that once the core is uniform and like homogeneous particles are formed, we can add the progressively like amount of or increase the amount of polymer from the cell, and for the cell, then we can like increase the thickness of the particles. If we check by transmission electron microscopy, then you can see that the number 1 here 110.07 nanometer. This is 148 nanometer, 158 nanometer, and then 160 nanometer. Here you can see the core cell image. This was the core of methyl rylate and anisopropyl. And this is the cell of N-isopropyl. Increase of the cell thickness. Here is very less visible, not clearly visible. Here you can see very less one, and here this is visible, almost visible, and here the cell thickness is increased. We can see in this way we can make some coral particles, and they are thermoresponsive particles. Later we have studied for 20 and 40 degrees Celsius by UV and other methods or cumulative studies, and it was very good, and it was showing thermoresponsive properties. So these are the glimpse of the core cell images, how beautiful and how uniform you can see there. And the size is only 200 nanometers. The of these particles is 200 nanometers. So they are in sub-micrometer range. Here 1 nanometer, and this is around 165 nanometer. So below 100 nanometer. So, but they can be properly controlled. The good thing is that they can be properly controlled. So in the next, we can see here these are the particles that we have made, polyelectrolyte complex particles. As you can see, if you like increase or if you see in a high resolution SEM, you can see the like surface of the particles, how beautiful and how the uniform homogeneous particles were synthesized. So these are the years of work while making these particles. And these particles were the neem seed oil based particles were very good. This is the neem plant. You see, these are the seeds we've collected. Then from seeds, we have extracted the oil. This is the basic chemistry part. And then the oil was, for in some cases the oil is purified, and for pesticide use the oil was not purified, and it was encapsulated. Once encapsulated, this gives this free flowing fine particle. It's coming.
Yes, ma'am, you are audible.
Okay, fine. So let me share again. Is it visible now?
No, ma'am.
The slide is visible now.
Not visible.
Okay. So let me share again. Save it. Okay. It should be visible. Is it visible? Is it visible now?
No, ma'am. Starting to share content, something like that.
I think it will take time. I've shared already. You are saying the screen is coming.
Maybe network is a little bit slower here.
Okay, people are being it's showing it's sharing. Okay, let me continue up to that because we get
Yes.
a problem. Maybe network or maybe network. Let me connect with another internet connection. Once you see, please let me know that you can see the slide. connection. So is it visible now?
No, ma'am.
No? Okay. Maybe some other problem.
Now
Okay.
visual.
Yep. Now visible. I have stopped sharing. I will share it again.
Okay. Yes, ma'am, visual.
It's visible. No? Fine, fine, fine. Okay. So these were the like controlled risk biopesticide, like your polyelectrolyte complex microparticles, and these are already marketed in the market and was taken by some one fertilizer company in Baroda. They are preparing lots of pesticides and other materials too. And one of their products is this one. So I was working for them, some viewers for consulting their work. So this was one of the good work that we have done, though the works are very simple, but they are very applicable. Application is very good. Now, once we made all these things, we were thinking about why only the spherical particles, why not make some like some thread-like or some nanoneedles kind of particles. If we can make the spherical, why can't we make them like needles? Because in case of drug delivery like in case of some case of like intravenous or in some cases, these needle type or nanorod type particles are very effective compared to the spherical particles. So because they can easily penetrate through the cells and they can go directly for their action. So that's why our work was mainly for designing the particles. So we were focusing on making some nano needles. So that's why we have prepared these nano needle kind of particles. And you can see here beautiful particles like this. Looks like a finger, but their size you can see 0.2 nanometer here, like 0.2 micrometer. This is 0.5 micrometer. This is the length. So they are only, we can see here, this is 50 nanometer. This is the scale. So they are, this is your 369. This is something wrong. They have given the same. This is 369. The length is 369 and the breadth was this one, 88, around this. So 65 to 88. This was 65 to 88. That means it is less than 100 nanometer and the length was around your 360 to 873. Length was like this. And then they are very beautiful nano needles were formed. And this is your SAT image you can see here, because we have encapsulated some of the active agents which are still not published. So we are not going detail. However, these kind of particles are also possible. Then you can make, because they are made in some core cell way that I have shown you, anisopropyl acrylamide particles. In that way, these are also prepared like core and cell. So in this way, but they were spherically, initially the particles were like this. So initially in half an hour of reaction, after 1 hour of reaction, the particles were like this, just spherical. But once the reaction goes on, like they were core cell particles that I have shown you already, they goes on attaching to one another. They're very sticky particles. They goes on attaching one after another. In this way, they goes in this way that they makes one. Finally, they makes these kind of shapes, and after saturation of the reaction, they finally makes needle shape. They are so beautiful, and we were like this work is so interesting that my students who carried out the work was very interested in doing this kind of work. So finally we made some nano needle kind of things, and we tried to encapsulate some of the drugs in these needles. So still not published. So said in some high rated journals. So once it's published, I will tell you details about all this making these particles. But still, you can see the core cell method, the particles and how they are agglomerating, but they are not agglomerating in just haphazard way. They are sticking in one by one and making some needles in this way. So this is the beauty of these particles. We have also did some of the encapsulation in addition to that of curcumin, and also, so one of my student who was working as a CRF, she worked on curcumin encapsulation for your, because it is your exhibits, curcumin exhibits, it is from turmeric, and the improving the aqueous solubility of curcumin is very needed because of the, like, it has very less bioavailability. So increase the bioavailability, we have to increase the aqueous solubility of curcumin, and for that the polymer was used as an encapsulating material. And she did, I said that one of our students, Shayanika Deka and Lipika Aidev, did these works. And then Vice Chancellor of Deoghar University, A.K. Burakbhai and A.K. Kakoti, all were the authors. And she did for chytogen and then cytogen phosphate TPP, like cytogen phosphate and sodium tripolyphosphate pentabasic. By this way, she did the curcumin encapsulation. So we'll be not going in detail because our talk was on complex conservation. This was not a conservation, but this was a simple conservation work. And she did encapsulation of curcumin in the simple way. You can see here curcumin in ethanol. She used ethanol because curcumin is not soluble in water. So she dissolved it in ethanol, then dropwise addition of curcumin. This is your cytogen, then the TPP in water, then dropwise addition, and then finally she started for 1 hour and made some this. However, they are very good. The shape was not like not needle, not spherical, but they are like triangular. Most of them were having the semi-spherical shape or triangular shape. So, but the SAD image is this one, very beautiful SAD image you can see here. And we have also encapsulated, the Sayanika Deka, she has also encapsulated theophylline, another drug, in gelatin pectin complex conservate as part of extension of the earlier work. Other experiments that I have said that we are mainly doing the encapsulation works. We are also doing some wood-based and plastic waste composite material based works. So since our lecture is going to be, I think it's of 2 hours 4:30, it will be finished. So I'll just quickly tell show some few slides that other works what we are doing. So in the complex conservation, this was the main thing, that mainly the optimization of the polymers, then the encapsulation and the responsiveness of the particles. First thing is that at which size will make, spherical or needle shape. Second thing is that what is the thickness of the particles will make. Third thing is the what ingredient we are encapsulating, for what we are doing that. The encapsulating properties of the encapsulating active agent, that one. The properties of the polymers, then the optimization of the polymers, then the optimization of the whole process, and then the styling as well as drying. All these things matters while designing these particles. So sometimes that's why it is called that these methods are not always science. Sometimes they are like art. Making them is a art. So making and designing them is art. So since we were working on plant oil based works, so why not to one of our student Parinita Das, she said that why not to make some resins, since we already extracted there lots of plant oils from neem. So she made some resins, and the same way the neem she has collected and then extracted from that time. I was working in NIT Nagaland, National Institute of Technology Nagaland. So she extracted, and this work was done under Ministry of Donor Ministry project, Northeastern Council project. And she was working as a JRF as well as a research scholar under my guidance. So she extracted and then purified the oil by TLC method. She done the confirmation of purification. Then she physiochemical properties of the neem oil she did, and the percentage yield was 23% for the Chumukudima or the Nagaland based neem seeds. Then acid value was found this one, then iodine value was 76, and saponification value was 176. She also did the fatty acid composition of this neem seed oil, and percent composition was found. You can see here your caprylic acid 15%. All this percent composition studies she did, and finally from the seeds she made some resins by just simple methods using some of the different catalysts, like lead monoxide. First initially she used, but later she has replaced the lead monoxide with sodium hydroxide and other copper oxide nanoparticles. She added glycerol with, this is the oil, triglyceride. She added glycerol and then catalyzed by lead monoxide and other catalysts at 220 degrees Celsius. It was a monoglyceride and diglyceride. Then she added maleic and phthalic anhydride, and finally got the resin. So this is the whole resin ABCD, 100% phthalic, 75% phthalic and malic, 25% malic, then 50-50 phthalic and malic anhydride, then 25 and 75%. This is the oil composition. This composition was how it is made. See how we can weight this one according to the initially the oil. What is the molecular weight of the oil? That has to be calculated, or that has to be identified. When the molecular weight is known, then we can calculate is as per the molecular basis, like how mole in the molar calculation was done, and as a gram wise it was found this. We can add this amount of phthalic and malic anhydride, and finally the resinification was done. You can see the acid value of the oil continuously decreases acid value when the reaction was complete. So initially the acid value was very high, then it goes down. So monitoring the acid value was one of the method to see the progress of the reaction. So finally, you can see here, I said that we have to first know what is the molecular weight of the oil, and the molecular weight was 967. This number average molecular weight average molecular weight was 1199. Then polydispersity index was this one. This all were done by GPC gel permeation chromatographic technique. Then resin ABCD, you can see here increasing the average molecular weight 2300, 2500, then 25, 35, 37. So gradually the molecular weight was increasing due to the addition of malic anhydride, which acts as also as like cross-linking and all the things. So then curing was done by using your blending with epoxy resin and cobalt octate, and you can see here films. After making the resins, she made some resin ABCD films, and you can see here these films are transparent, very good color. You can see here this is your wine red color. It is giving wine red color, and like very good films. You can again change the color. You can see resin D was blackish color. It is a dark brown, and then your dark wine red. This was a wine red. B was very good, and then resin A. After making these resins, she did some pencil hardness like gloss, all this kind of studies or testing she did. After that, she did specifically the chemical resistance test by common methods in 10% HCl, hydrochloric acid, then sodium hydroxide, and then sodium chloride. What we can find here that for resin ABCD, you see fair, fair, excellent, fair, fair, poor, very poor, fair, excellent, excellent, excellent. That means what we have got that the sodium chloride resistance is very good. So this has given us the clue that we can use this resin as a marine anti-coating, like anti-coating applications. So why not to go for some corrosion studies? So we have done some thermal studies and then goes for corrosion studies. For corrosion studies, we need mainly to go for, if you go for corrosion studies, we have to do some water contact angle because we need some water repelling characteristics is needed. One is your sodium chloride resistance because your marine or this kind of parts like marine water is like excess salt, no? So there should be salt resistant. So that's why we have selected these resins to study for corrosion resistant resins. And for that, the need is one is the water contact angle studies. So you see for water contact angle we did in our physics laboratory. So Devaran Purakayastha, he has done all this, he has given us the support. And the water contact angle you can see here for the resin A is 72.2, 81, 94 and 97. That means though it was a dark brown, the last one, resin D, but the water contact angle was higher for this one, resin D. So since our work was making corrosion resistance for application in marine anti-vessel coating, so that's why we have selected this resin D. And for the resin D, we did the corrosion resistance study. Here you can see the uncoated panel. This is a steel panel. And iron panel, this is your corrosion study we did. And then you see here coated panel, this is then this is your cut. This we have cut as an N. Here you can see the N. If you see closely, you can see the N here. N is cut so that if it gets water may move here, water and salt can go there part, and it will enhance the corrosion. So in this way, this is a coated panel completely, and this is your cut panel. So cut coated panel. So here you can see resin A and A, B, C, D. Here you can see that the corrosion in the uncoated panel before immersion was this. Then after immersion, you see so much of corrosion on 4th day and 6th day, it's high corrosion. But in case of resin coated panels, the corrosion was very less. So we have finally said that anti-corrosive coatings can be made from this kind of polymers, and this article was recently published in 2021, last year, in Polymer Bulletin. And she is Parinita Das, working as a PhD scholar, and she did all kind of these things. Next, she also thought that why we cannot like speed up the reaction. So if you can speed up the reaction to some, or we can change the catalyst, because lead monoxide is toxic, as well as like we don't want to use the lead monoxide, so or we can decrease the time of the reaction. So for that, she used copper oxide nanoparticles as a co-catalyst. Along with the catalyst, she used copper oxide nanoparticles. She synthesized the copper oxide nanoparticles. These are the copper oxide nanoparticles you can see here. DLS study shows around your 240 nanometer size of the copper oxide nanoparticles. These are the copper oxide nanoparticles. They're spherical, very good picture you can see here. This was not like here also you can see the copper oxide nanoparticles, the size and shapes, and here you can see the very good copper oxide nanoparticles. And this is your SAT image of the copper oxide nanoparticles synthesized. So by using these synthesized copper oxide nanoparticles, he has again did the acid value versus time, and after that degree of polymerization, because we need to speed up the reaction now. How to speed up the reaction of these NIM-based resins? Then what she did is that she like what we did, like NR, the initial one, the N109 is for copper oxide, amount used 109 gram, the like your milligram. Then is N219 is copper oxide, 219 milligram amount this was used. So this is without copper oxide. So you see here degree of polymerization. This is time, your acid value at 0 time, the CT is acid value at time 180 minutes, and your P is extent of reaction. This is degree of polymerization. You can see here when we calculated by using this formula, you can see here degree of polymerization increased from 5.5 to 16 and then 20. That means copper oxide nanoparticle, if we use as a co-catalyst, then it can increase the degree of polymerization and reduce the time of the reaction. So if we go for reconfirming it or reassuring it, we have also done some molecular weight studies, because if it is like polymerizing too fast, then the molecular weight should be increasing. So resin with copper oxide nanoparticle N219 and without copper oxide nanoparticle is NR. You see at various stage time, these all are done by GPC, gel pyrimidine chromatography, N219 and NR. You can see molecular weight, PDI, and molecular weight you can see here, 2116, 2130, 24. After time 0, 30, 60, 120, and 180, the molecular weight is increasing progressively. That means copper oxide nanoparticle is really working and reducing the things. Now thing is that since we were specifically focused on making anti-corrosive coatings, so water contact angle analysis again we did for comparison. And for comparison here we have taken the we said already in the last work that 72, 94, 102. So this one, the earlier was ABCD, this one. So if we test this one here, only given this one, we have also worked for this one also. But for the 71, resin A, 72, what we did, it was 72. Initially, this is NR, the same. This NR is the resin A. So this is your 72.2 degree water contact angle. And with using copper oxide nanoparticles, it was 94. It is 102. So the contact angle is also increasing, and corrosion study shows the better anti-corrosion properties with the copper oxide nanoparticles. Here you can see here. Now we did for why not to compare with some traditional paints, and this was the uncoated panel. Here you see mild steel. This was the mild. This was your mild steel uncoated panel. This before immersion, and this is paint coated panel. We have painted the Asian paints, the common paints, the resin NR, then resin N109 and resin 219. Here you can see Here you can see before immersion and after immersion of 4th day, and this is again 6th day. Here you can see this is a blank panel, uncoated panel shows the corrosion as earlier. The paint coated panel you can see here. We're surprised to see that while immersing in water, you can see here in salt water, this is the Asian paints. It just flows off, no? It's swelling. was occurring, and after 4th day, this was the Asian paint you can see, and our the resin shows very improved properties, better than in comparison to Asian paint in that work, and she is communicating the work. And I think time is over. I think we will not be discussing about the other parts. Still, these are the neem dust, and by using the neem dust, another of our students, Bhamsi Nerethi Ratnam, he was BSMS student, was doing BS and MS in material science. So he did his master's thesis work with this. Since we are working on neem, so he collected some neem dust and did some of the processing and then prepared some composites. These were the neem dust composites he prepared with some waste plastics that I already said. We did some waste plastics of polyethylene, polypropylene, mainly 4 type. Here you can see this one, 4 type of plastics he has chosen. This one, polymer blend with your SDP, high density polyethylene, LDP, PP, and PVC, all were taken from laboratory waste. So all the laboratory waste were taken out, and then in this ratio, he made these composites with neem dust. And finally, he made some of the composites which also had some like better properties. He also published the paper in Composite Science Journal. And these are all the blocks that he has made. And he also made some transparent WPCs that time. And finally, I'm not going to detail of this one. Another scholar is doing on this polyparaffinic diamine-based nanocomposites. There is a different one. If we get time later, we may speak to this one sometime. So finally, regarding all these thing is that our aim is to finally to go from Millennium Development Goal to our Sustainable Development Goal by 2030. Will you be able to reach the goal? Or what is the role of a plastic material engineer? Or what is the role of a polymer chemist? Or what is the role of a chemist or a technologist in achieving the Sustainable Development Goal? So our main goal should to achieve how like a point 1 or 2 are there in Sustainable Development Goals related to environment, related to sustainability, and how as a chemist we can contribute to the Sustainable Development Goal. So this is our takeaway to home. So there is no limit. We still think that there is no limit. The people can do anything from anywhere in any limitations. So there is no limit to the amount of good one can do if we don't care about who gets the credit. The main problem is that we think about who gets the credit. If we don't think about the credit, I think anyone from any place can do lots of works. So, but the thing is that one like open mind is required always. So things in chemistry or in science or in technology, every time the things are changing. What we thought or what we did earlier is changing very quickly. In the 5 or 10 years, everything is becoming unused or new theories are coming out. So every time in this generation is that like learn, unlearn, relearn. These 3 things we have to carry our entire life. So in the Future Shock, he is written in the Future Shock, one good book is there of Alvin Toffler. He said that the illiterate of the 21st century will not be those who cannot read and write, but those who cannot learn, unlearn, and relearn. So we as a teacher or we as a researcher, we must have to know how to learn, then how to unlearn, and then relearn. Then only I think we can go for research. And above all, the thing is that for the research or for all these kind of things, stay hungry, stay foolish. Sometimes we need to stay foolish to do these works. So people will ask anyone what you are getting by doing all these things, just spoiling life or just wasting your time. Or sometimes we need to be foolish to work on the same thing or same field or focusing on the same field. So above all, stay hungry and stay foolish. I think this should be our motto. I wish to thank CIPET Guwahati for providing this opportunity for this platform to interact with the participants. We also thank SEED Division DST for providing generous funds. The composite work was done under the SIT Division DST Fund, CSR New Delhi. They have given one project, and Northeastern Council Shillong. That project was done by Parinita Das. I have already said NIM-based oil resin-based projects, and National Institute of Technology Nagaland, CIPET Jaipur, and DONA International Institute of Assam. I wish to thank all of them and these three funding agencies for their generous funding. And I hope, yes, greening is possible. So thank you, all the participants. If you have any questions, I'll be happy to.
Thank you very much, ma'am. Thank you very much for this informative session, covering all the details related to biodegradable plastics, plastic roads, complex conservation, micro encapsulation, chemical resistance, optimization techniques, core cell micropolymer, polymer dispersity, covering all this. So the session is now open for interaction. If any participants wants to interact with ma'am, they can raise their hands. Or they can write in the chat box also. Is there any questions? Okay. Thank you very much, ma'am. Thank you very much for giving us your valuable time. Thank you.
You're welcome. If you have any questions, any participants, if you have any questions, you can ask me anytime. My email ID is there, and we can collaborate. We can discuss, or we can share our findings, or we can share our ideas sometimes. And if we get offline, that will be very good sometime, or see you sometime soon.
Thank you, ma'am.
Can I leave now, or is there any question?
Yes, ma'am. You can leave now. Thank you very much for this session.
Thank you, Jyotika, and thank you, Dr. Jyotika. Thank you, Dr. Hare Krishna, and Director CIPET-GUWAHATI. So thank you for giving the opportunity. We will share our ideas, and thank you all for your nice arrangement and all the participants.
Thank you, ma'am. Yes, so the session will resume tomorrow again at 9:30 a.m. At 9:30 a.m. tomorrow, the session will be opened by Professor Niranjan Karak from Tezpur University. You will speak on the topic polymer matrix-based nanostructural materials for biomedical applications. So I request all the participants to join by 9:30 a.m. tomorrow morning. And for the test, the study materials are already uploaded at the Auto portal. You can go through that. Thank you very much. And for today, the session has ended. Thank you.